1. The most widespread and abundant tissue in the body is A. Epithelial. B. Connective. C. Muscle. D. Nervous. B. Connective. 2. Blood is a member of which basic tissue type? A. Epithelial. B. Connective. C. Muscle. D. Nervous. B. Connective. 3. How can epithelial tissue be described? A. Forms glands. B. Contains mostly extracellular matrix. C. Forms membranes. D. Both A and C. D. Both A and C. 4. Which of the following epithelial functions is a primary activity of glandular epithelium? A. Protection. B. Secretion. C. Sensation. D. Excretion. B. Secretion. 5. What structure is formed by the union of the basal and reticular lamina? A. Nucleus. B. Basement membrane. C. Lysosome. D. Endoplasmic reticulum. B. Basement membrane. 6. Which is not a function of epithelial tissue? A. Absorption. B. Secretion. C. Assimilation. D. Protection. C. Assimilation. 7. Which of the following is not a function of adipose tissue? A. Insulates to conserve body heat. B. Defends the body from microbes and injurious substances. C. Supports and protects the kidneys. D. Stores excess food. B. Defends the body from microbes and injurious substances. 8. Which is not a function of connective tissue? A. Transport. B. Support. C. Defense. D. Communication. D. Communication. 9. Collagenous fibers can be found extensively in blank tissue. A. Epithelial. B. Connective. C. Muscle. D. Nervous. B. Connective. 10. The type of tissue referred to as loose ordinary connective tissue is A. Areolar. B. Adipose. C. Reticular. D. Cartilage. A. Areolar. 11. The basic organizational or structural unit of compact bone is called the A. Canaliculi. B. Lamellae. C. Lacunae. D. Aversian system. D. Aversian system. 12. Cartilage is a form of blank tissue. A. Epithelial. B. Connective. C. Muscle. D. Osseous. B. Connective. 13. The mature cells of bone are called fibroblasts. B. Osteoclasts. C. Osteocytes. D. Osteoblasts. C. Osteocytes. 14. The most prevalent type of cartilage is a hyaline. B. Fibrous. C. Elastic. D. Synovial. A hyaline. 15. Which of the following is not considered a formed element in the blood? A. Erythrocyte. B. Thrombocyte. C. Astrocyte. D. Leukocyte. C. Astrocyte. 16. The type of tissue that contains cells called neurons is called muscle. B. Epithelial. C. Connective. D. Nervous. D. Nervous. 17. Which of the following is another name for skeletal muscle? A. Striated voluntary. B. Non-striated involuntary. C. Striated involuntary. D. Pseudostriated involuntary. A. Striated voluntary. 18. Basement membrane is composed of molecules made by blank tissue. A. Muscle. B. Connective. C. Epithelial. D. Both B and C are correct. D. Both B and C are correct. 19. Areolar tissue usually contains which types of cells in the greatest number? A. Macrophages. B. Fibroblasts. C. Mast cells. D. Phagocytes. B. Fibroblasts. 20. Cells found only in cartilage include achondrocytes and fibroblasts. B. Chondrocytes and macrophages. C. Chondrocytes and mast cells. D. Only chondrocytes. D. Only chondrocytes. 21. Which of the following is not a characteristic of skeletal muscles? A. Having one nucleus per cell. B. Being attached to bone. C. Having striations. D. Having voluntary or willed muscles. B. Having intercalated discs. 22. Which of the following is not a characteristic of smooth muscles? A. Having one nucleus per cell. B. Having intercalated discs. C. Composing the walls of the viscera. D. Usually not being under voluntary control. B. Having intercalated discs. 23. Which of the following is not a proteoglycan found in the matrix of connective tissue? A. Glucosamine. B. Collagen. C. Hyaluronic acid. D. All of the above are proteoglycans. B. Collagen. 24. Cancellous tissue is an example of which type of connective tissue? A. Cartilage. B. Bone. C. Dense connective. D. Loose connective. B. Bone. 25. An axon is an important part of which kind of tissue? A. Nervous. B. Smooth muscle. C. Cardiac muscle. D. Glandular epithelium. A. Nervous. 26. Connective tissue forms from embryonic tissue called mesenchyme. B. Blastocyst. C. Endoderm. D. Ectoderm. A mesenchyme. 27. Which of the following is not a class of cartilage tissue? A. Hyaline. B. Fibrocartilage. C. Cancellous. D. Elastic. C. Cancellous. 28. Which type of connective tissue helps newborns maintain body temperature by producing heat? A. Dense fibrous tissue. B. Beige fat. C. Brown fat. D. White fat. C. Brown fat. 29. Small spaces in the bone where osteocytes are located are called lacunae. B. Lamellae. C. Canaliculi. D. Marrow. A. Lacunae. 30. Hematopoietic tissue can be found in the A. Heart, B. Lungs, C. Bones, D. Intestines. C. Bones. 31. Which cells regulate neuron function, including protection from harmful toxins? A. Oligodendrocytes. B. Neurons. C. Astrocytes. D. Microglia. C. Astrocytes. 32. Which cells electrically insulate axons to increase the speed of conduction? A. Oligodendrocytes. B. Schwann cells. C. Astrocytes. D. Both A and B. D. Both A and B. 33. Which cells help destroy pathogens and damaged tissue in the brain? A. Oligodendrocytes. B. Schwann cells. C. Astrocytes. D. Microglia. D. Microglia. 34. Dense irregular fibrous tissue is not found in which of the following structures? A. Walls of arteries. B. Capsule surrounding the spleen. C. Fascia surrounding muscles. D. Lymph nodes. A. Walls of arteries. 35. Dense regular fibrous tissue is not found in which of the following structures? A. Tendons. B. Dermis of the skin. C. Ligaments. D. All of the above contain dense regular fibrous tissue. B. Dermis of the skin. 36. The cell that has the opposite function of the osteoblast is the A. Chondrocyte, B. Osteocyte, C. Osteoclast, D. Fibroblast. C. Osteoclast. 37. Which of the following is not a characteristic of cardiac muscle? A. Cells separated by intercalated discs. B. Also called non-striated involuntary muscle. C. Found in the heart. D. All of the above are characteristics of cardiac muscle. B. Also called non-striated involuntary muscles. 38. Epithelial cells can be classified according to shape. Which is not a characteristic shape of epithelial cells? A. Rectangular. B. Cubed. C. Columns. D. Flat. A. Rectangular. 39. Being able to readily diffuse material through itself, such as occurs in alveoli, is a characteristic of which type of epithelial tissue? A. Stratified columnar. B. Simple columnar. C. Stratified squamous. D. Simple squamous. D. Simple squamous. 40. Goblet cells, cilia, and microvilli are modifications of which type of epithelial tissue? A. Simple squamous. B. Simple cuboidal. C. Simple columnar. D. Pseudostratified squamous. C. Simple columnar. 41. Keratinized stratified squamous epithelium is found in the A. Mouth, B. Esophagus, C. Epidermis, D. Vagina. C. Epidermis. 42. Glands that have no ducts but release their products directly into tissue fluid and blood are called endocrine. B. Exocrine, C. Holocrine, D. Apocrine. Endocrine. 43. Oil-producing glands that self-destruct in order to function are referred to as merocrine. B. Apocrine. C. Endocrine. D. Holocrine. D. Holocrine. 44. How many layers make up pseudostratified epithelium? A. 1b. 2c. 3d. Numerous. A. 1. 45. Which of the following would be identified as skin covering? A. Pseudostratified columnar epithelium. B. Stratified squamous epithelium. C. Pseudostratified squamous epithelium. D. Stratified squamous non-keratinized epithelium. B. Stratified squamous epithelium. 46. Which of the following exocrine glands constitutes the mammary glands? A. Merocrine. B. Apocrine. C. Holocrine. D. All of the above. B. Apocrine. 47. Which of the following is the functional classification of salivary glands? A. Merocrine. B. Endocrine. C. Apocrine. D. Holocrine. A. Merocrine. 48. Which is not characteristic of reticular tissue? A. It is a major component of the body's defense process. B. It is found in bone marrow. C. It makes reticular fibers. D. All of the above are characteristics of reticular tissue. D. All of the above are characteristics of reticular tissue. 49. Reticular tissue does not form the framework for which of the following? A. Kidney. B. Spleen. C. Lymph nodes. D. All of the above are composed of reticular tissue. A. Kidney. 50. Which of the following is not true of simple squamous epithelium? A. It is one layer thick. B. It prevents the diffusion of material from one part of the body to another. C. It is composed of flat, scale-like cells. D. All of the above are true of simple squamous epithelium. B. It prevents the diffusion of material from one part of the body to another. 51. Which of the following is not true of simple cuboidal epithelium? A. It is one layer thick. B. It is composed of cuboidal cells. C. It is found in ducts or tubules of the kidney. D. All of the above are true of simple cuboidal epithelium. D. All of the above are true of simple cuboidal epithelium. 52. Microvilli are found on which types of cells lining of the intestine? A. Pseudostratified epithelium. B. Simple columnar epithelium. C. Stratified cuboidal epithelium. D. Simple cuboidal epithelium. B. Simple columnar epithelium. 53. Cilia are found on which type of cell in the lining of the respiratory tract? A. Pseudostratified epithelium. B. Simple columnar epithelium. C. Stratified cuboidal epithelium. D. Simple cuboidal epithelium. A. Pseudostratified epithelium. 54. Glandular epithelium is usually composed of blank epithelium. A stratified cuboidal, B stratified columnar, C pseudostratified columnar, D. None of the above is correct. D. None of the above is correct. 55. The functioning of which of the following glandular tissues does not injure the cell or cause a loss of cytoplasm? A. Apocrine, B. Endocrine, C. Merocrine, D. Holocrine. C. Merocrine. 56. Microvilli assist epithelial tissue in protecting the underlying tissue. B. Releasing substances from glands. C. Absorbing nutrients. D. All of the above functions. C. Absorbing nutrients. 57. Another term for a ductless gland is in blank gland. A. Exocrine, B. Endocrine, C. Alveolar, D. Both A and C are correct. B. Endocrine. 58. The type of cell found in connective tissue that releases histamine is A. Fibroblast, B. Macrophage, C. Mast cell, D. Areolar cell. C. Mast cell. 1. Which of the following vitamins is absorbed through the skin? A. Vitamin A, B. Vitamin D, C. Vitamin K, D. All of the above. D. All of the above. 2. Which of the following is not a function of the skin? A. Defense against disease organisms, B. Synthesis of vitamin E, C. Regulation of body temperature, D. Excretion of water and salts. B. Synthesis of vitamin E. 3. The superficial outer layer of the epidermis is the stratum basale. B. Lucidum, C. cornuum, D. granulosum. C. cornuum. 4. Of the 5 epidermal cell layers, the only one that can undergo mitosis is the stratum basale. B. lucidum, C. cornuum, D. granulosum. Basale. 5. The area referred to as true skin is the A. stratum cornuum, B. subcutaneous layer, C. dermis, D. hypodermis. C. dermis. 6. The hypodermis connects the dermis to underlying tissues. B is the layer of skin in which hair is produced. C connects the dermis and the epidermis. D is the layer of skin in which the nails are produced. A connects the dermis to underlying tissues. 7. In what area of the body would you expect to find an especially thick stratum cornuum? A. Back of the hand, B. Thigh, C. Abdomen, D. Sole of the foot, D. Sole of the foot. 8. The papillary layer of the dermis, A, is responsible for cleavage or tension lines in the skin. B does not contain blood vessels. C produces the ridges that make fingerprints. D contains large deposits of fat. C produces the ridges that make fingerprints. 9. Smooth muscles that produce goosebumps when they contract are the blank muscles. A. Papillary, B. cuticle, C. medullary, D. arrector pili. D. arrector pili. 10. The most common type of skin cancer is a malignant melanoma. B. basal cell carcinoma. C. Kaposi sarcoma. D. All skin cancers occur in about equal frequency. B. Basal cell carcinoma. 11. The type of cancer associated with immune deficiencies is a squamous cell carcinoma. B. Kaposi sarcoma. C. Basal cell carcinoma. D. Malignant melanoma. B. Kaposi sarcoma. 12. Prolonged exposure to the sun causes melanocytes to increase in number. B. Rupture and release their contents. C. Increase melanin production. D. Decrease melanin production. C. Increase melanin production. 13. The hair follicle is found in the A. Epidermis, B. Dermis, C. Hypodermis, D. Subcutaneous layer. B. Dermis. 14. Fingernail growth is the result of the mitosis of the cells in the stratum germinativum. B. Granulosum, C. cornum, D. lucidum. Germinativum. 15. Apocrine sweat glands can be found in all of the following areas except the A. soles of the feet, B. armpits, C. areola of the breasts, D. pigmented skin areas around the anus. A. soles of the feet. 16. The type of gland associated with blackheads is acrine, B. apocrine, C. sebaceous, D. ceruminous. C. sebaceous. 17. Which is not part of a hair? A. Shaft. B. Root. C. Lanugo. D. Medulla. C. Lanugo. 18. Hair alternates between periods of growth and rest. B. Consists of keratinized cells. C. Is formed from cells of the germinal matrix. D. Is all of the above. D. Is all of the above. 19. The hair papilla consists of blank tissue. A. Epidermal. B. dermal. C. Hypodermal. D. Fibrous connective. B. dermal. 20. The most numerous, important, and widespread sweat glands in the body are apocrine, B. acrine, C. ceruminous, D. sebaceous. B. acrine. 21. Sebum lubricates hair and skin. B. is produced by sweat glands. C. consists of dead cells from hair follicles. D. is responsible for body odor. Lubricates hair and skin. 22. The waxy secretion in the external air canal is acrine, B. apocrine, C. sebaceous, D. ceruminous. D. ceruminous. 23. The surface film found on the skin has a variety of functions, including lubrication, B. buffering of caustic irritants, C. antibacterial and antifungal activity, D. all of the above. D. all of the above. 24. Although body temperature normally changes very little during the course of a day, it is generally the lowest during the early morning, B. mid-afternoon, C. late afternoon, D. the evening. At the early morning. 25. The conversion of water from a liquid state into a gaseous state happens with which form of body heat loss? A. Convection. B. Evaporation. C. Radiation. D. Conduction. B. Evaporation. 26. Which type of body heat loss is characterized by heat transfer from the surface of one object to the surface of another object without actual contact? A. Convection. B. Evaporation. C. Radiation. D. Conduction. C. Radiation. 27. The body compensates for the increase in the core body temperature caused by exercise by decreasing the blood flow to the skin. B. Increasing the blood flow to the core. C. Increasing the blood flow to the skin. D. Vasoconstriction of the blood vessels in the skin. C. Increasing the blood flow to the skin. B. Evaporation is retarded in humid climates. 29. A person leaning against a cold cement block wall would lose heat by the process of a convection. B. Evaporation. C. Radiation. D. Conduction. D. Conduction. 30. The body's temperature control center is located in the A. Cerebrum. B. Medulla. C. Thalamus. D. Hypothalamus. D. Hypothalamus. 31. A second-degree burn is characterized by a destruction of both the epidermis and the dermis. B. Severe pain, generalized swelling, and edema. C. Minor discomfort and some redness. D. Involvement of muscles, fasciae, or bones. B. Severe pain, generalized swelling, and edema. D. Are characterized by insensitivity to pain immediately after injury. 33. In the skin, the dermis A and epidermis are both epithelial tissue. B and epidermis are both connective tissue. C is connective tissue and the epidermis is epithelial tissue. D is epithelial tissue and the epidermis is connective tissue. C is connective tissue and the epidermis is epithelial tissue. 34. The layer beneath the dermis is called the A. hypodermis. B. Subcutaneous layer. C. Superficial fascia. D. All of the above are correct. D. All of the above are correct. 35. Which cells originate in the bone marrow and are important in the immune function? A. Dendritic cells. B. Melanocytes. C. Keratinocytes. D. Fibroblasts. A. Dendritic cells. 36. Which skin layer is called the barrier area? A. Stratum lucidum. B. Stratum basale. C. Stratum granulosum. D. Stratum corneum. D. Stratum corneum. 37. Which skin layer has cells that look prickly because of the desmosomes that join the cells together? A. Stratum basale. B. Stratum spinosum. C. Stratum granulosum. D. Stratum corneum. B. Stratum spinosum. 38. Which skin layer contains closely packed, clear cells that contain a gel-like substance called ellatin? A. Stratum lucidum. B. Stratum basale. C. Stratum granulosum. D. Stratum corneum. A. Stratum lucidum. 39. In which skin layer does the process of keratinization begin? A. Stratum basale. B. Stratum corneum. C. Stratum granulosum. D. Stratum spinosum. C. Stratum granulosum. 40. Normally, which percentage of the cells in the stratum basale enter mitosis each day? A. 20% to 25%. B. 10% to 12%. Circa 18% to 20%. D. 35% to 40%. B. 10% to 12%. 41. Which of the following is not true of the dermal-epidermal junction? A. It is important in blocking bacteria from passing through the skin. B. It is composed chiefly of basement membrane. C. Its function is to glue the two layers of skin together. D. All of the above are true. A. It is important in blocking bacteria from passing through the skin. 42. Which of the following is not true of the dermis? A. It contains a papillary layer. B. It contains a reticular layer. C. In general, the dermis is thinner on the dorsal side of the body than on the ventral side. D. It plays an important role in body temperature regulation. C. In general, the dermis is thinner on the dorsal side of the body than on the ventral side. 43. Burns can be caused by ultraviolet light. B. Corrosive chemicals. C. Electrical current. D. All of the above. D. All of the above. 44. The area of the skin in an average size adult is about blank square feet. A. 12 bits 18 circa 24. D. 31. B. 18. 45. The term used to describe the skin and its appendages is a epidermis. B. Dermis. C. Integumentary system. D. Integument. C. Integumentary system. 46. Which cells of the skin are filled with a tough, fibrous protein and account for most of the epidermal cells of the skin? A. Dermatocytes. B. Langerhans cells. C. Keratinocytes. D. Melanocytes. C. Keratinocytes. 47. Which cells of the skin act as a type of antigen-presenting cell in the skin? A. Dermatocytes. B. Dendritic cells. C. Keratinocytes. D. Melanocytes. B. Dendritic cells. A. Stratum corneum, lucidum, granulosum, spinosum, and basale. 49. The time required for the completion of mitosis, differentiation, and the movement of new cells from the stratum basale to the surface of the skin is about A. 35 hours. B. 17 days. Circa 22 days. D. 35 days. D. 35 days. 50. To increase the efficiency of protein synthesis, cells in which epidermal layer are rich in RNA? A. Stratum corneum. B. Stratum lucidum. C. Stratum spinosum. D. Stratum granulosum. C. Stratum spinosum. 51. Cells in which layer are filled with a protein called ellatin? A. Stratum corneum. B. Stratum lucidum. C. Stratum spinosum. D. Stratum granulosum. B. Stratum lucidum. 52. Cells in which layer have a high level of lysosomal enzymes in their cytoplasm? A. Stratum corneum. B. Stratum lucidum. C. Stratum spinosum. D. Stratum granulosum. D. Stratum granulosum. 53. The darkest of the skin pigments is a beta-carotene. B. Pheomelanin. C. Eumelanin. D. None of the above. C. Eumelanin. 54. Which skin pigment is a light reddish color? A. Beta-carotene. B. Pheomelanin. C. Eumelanin. D. None of the above. B. Pheomelanin. 55. When the skin looks cyanotic, it is because blank can be seen through the skin. A. Oxygen-poor blood. B. Oxygen-rich blood. C. Hemosiderin. D. Bile pigments. A. Oxygen-poor blood. 56. What increase in body temperature would be caused by pyrogens? A. Heat exhaustion. B. Heat stroke. C. Fever. D. Malignant hyperthermia. C. Fever. 57. What increase in body temperature can be caused by anesthetics or muscle relaxants? A. Heat exhaustion. B. Heat stroke. C. Fever. D. Malignant hyperthermia. D. Malignant hyperthermia. 58. Hair can become brittle and dry as a result of the A. Improper function of the sebaceous glands. B. Malfunction of the tactile corpuscle. C. Overproduction of keratin. D. Underproduction of synovial fluid. A. Improper function of the sebaceous glands. B. The subcutaneous layer has a rich blood supply and loose spongy texture. 60. Onarcolysis is usually caused by a cuticle infection. B. Malfunctioning of the tactile corpuscle. C. Overproduction of the root of the fingernail. D. Trauma to long fingernails. D. Trauma to long fingernails. 61. After several hours of landscaping the yard, Jennifer experienced a body temperature of 105 F, a rapid heart rate, headache, and hot, dry skin. She was taken to a medical facility and treated for what condition? A. Heat exhaustion. B. Heat stroke. C. Hypothermia. D. Malignant hyperthermia. B. Heat stroke. 62. Matt is admitted to the hospital with burns to the deep epidermal layers and injury to the upper layers of the dermis. The physician treats Matt's condition as a blank burn. A first degree. B. Hypothermia. C. Minor. D. Second degree. D. Second degree. 63. The special network of nerves deep in the dermis that is capable of detecting pressure on the skin surface is called a free nerve endings. B. Cross-end bulbs. C. Tactile corpuscle. D. Somatic sensory receptors. D. Somatic sensory receptors. C. They find markers on bacteria and other invaders and present them to other immune system cells for recognition and destruction. C. By the epidermal proliferating unit. 66. The fibers in which layer make it possible for skin to stretch and be elastic? A. Connective tissue. B. Epidermal. C. Muscle. D. Reticular. D. Reticular. B. Healing due to tiny tears in the dermis. D. Sweat, sebaceous, and ceruminous glands. B. Liver not being able to eliminate bile from the blood efficiently. 70. Immunity is a function of the skin, and occurs by attacking and destroying pathogens. B. Evaporation and radiation of pathogens. C. Excretion of chemicals in sweat. D. Receptors that can detect sensations. A. Attacking and destroying pathogens. 71. The skin of an infant is more easily damaged by penetration or abrasion than that of an adult. Which layer is probably thinner in an infant than in an adult? A. Stratum basale. B. Stratum corneum. C. Stratum lucidum. D. Stratum spinosum. B. Stratum corneum. 72. A geneticist informs parents that their newborn infant does not have the enzyme tyrosinase. The lack of this enzyme will result in albinism. B. Malignant hyperthermia. C. Scleroderma. D. Vitiligo. A. Albinism. 73. Which of the following is not true about thick or thin skin? A. Thin skin is hairless. B. Most of the body is covered in thin skin. C. Epidermal ridges are found in thick skin. D. All of the above are true. A. Thin skin is hairless. A. Just as the epidermis, the dermis is in a constant state of regeneration. 75. Which of the following is not true of the hypodermis? A. It is also called the subcutaneous layer. B. It contains mostly loose connective tissue and adipose tissue. C. It is the deepest part of the skin. D. All of the above are true. C. It is the deepest part of the skin. 76. The excretory function of the skin includes all of the following except A. Influencing the fluid volume of the body. B. Playing an important excretory role for the body. C. Removing uric acid and urea from the body. D. The excretory function includes all of the above. B. Playing an important excretory role for the body. 77. Which of the following is not true of the body's ability to regulate heat loss? A. It is part of a negative feedback mechanism. B. Sweat glands increase the production of sweat. C. The homeostatic regulation of body temperature is regulated by the thyroid gland. D. All of the above are true. C. The homeostatic regulation of body temperature is regulated by the thyroid gland. 78. Friction ridges function to form fingerprints and footprints. B. Enhance our ability to grip surfaces. C. Act as sensory aids that amplify vibrations. D. All of these are functions of friction ridges. D. All of these are functions of friction ridges. 1. A fracture in the shaft of a bone is a break in the A. epiphysis, B. periosteum, C. diaphysis, D. articular cartilage. C. diaphysis. 2. Endosteum can be found aligning the medullary cavity, B. covering bones, C. at articular surfaces, D. lining the epiphysis, C. at articular surfaces. 3. Muscle tendon fibers attach to bone by interlacing with a compact bone, B. ligaments, C. periosteum, D. endosteum, C. periosteum. 4. The organic matrix of bone consists of a collagenous fibers, B. protein, C. polysaccharides, D. all of the above, D. all of the above. 5. In bone formation, the cells that produce the organic matrix are the A. osteoblasts, B. osteocytes, C. osteoclasts, D. chondrocytes, A. osteoblasts. 6. The cells responsible for active erosion of bone minerals are called osteocytes, B. osteoclasts, C. osteoblasts, D. osteomorphites, B. osteoclasts. 7. Which of the following is not one of the primary functions performed by bones? A. Mineral storage, B. Protection, C. Hormonal production, D. Hematopoiesis, C. Hormonal production. 8. The cell organelles that synthesize organic matrix substances in bone formation are mitochondria and Golgi apparatus, B. ribosomes and Golgi apparatus, C. endoplasmic reticulum and ribosomes, D. endoplasmic reticulum and Golgi apparatus, D. endoplasmic reticulum and Golgi apparatus. 9. The ostean, or Havresian, system delivers nutrients to and removes waste products from bone cells. B. produces yellow marrow, C. resists stress, D. erodes bone, A. delivers nutrients to and removes waste products from bone cells. 10. An intramembranous ossification, the process of appositional growth, refers to the A. development of a core layer of spongy bone, B. development of compact bone in long bones, C. addition of an outside layer of osseous tissue on flat bones, D. lengthening of long bone, C. addition of an outside layer of osseous tissue on flat bones. 11. Hematopoiesis is carried out in the A. osteoclasts, B. osteocytes, C. yellow bone marrow, D. red bone marrow, A. in the diaphysis. 12. The primary ossification center of a long bone is located A. in the diaphysis, B. in the epiphysis, C. in the medullary cavity, D. at the epiphyseal cartilage, A. in the diaphysis. 13. The major purpose of the epiphyseal plate is amending of fractures, B. enlarging of epiphyses, C. providing strength in long bones, D. lengthening long bones, D. lengthening long bones. 14. The first step in healing a fracture is the formation of specialized callus, B. the formation of a fracture hematoma, C. proper alignment of the fracture, D. the formation of a collar of normal bone covering the broken ends. B. The formation of a fracture hematoma. 15. Normally, bone loss will begin to exceed bone gain between the ages of blank years. A. 20 and 25 bits 25 and 30 circa 30 and 35 D. 35 and 40. D. 35 and 40. 16. In bone growth, the medullary cavity is enlarged because of the activity of osteoclasts. B. Osteocytes. C. Osteoblasts. D. Chondrocytes. A. Osteoclasts. 17. The most abundant type of cartilage is a hyaline. B. Elastic. C. Fibrocartilage. D. All of the above are present in approximately equal amounts. A hyaline. 18. The form of the external ear is composed of a fibrocartilage. B. Elastic cartilage. C. Osseous tissue. D. Hyaline cartilage. B. Elastic cartilage. B. Cause a decrease in the thickness of epiphyseal plates in the growing long bones. 20. Which of the following substances is not part of the inorganic matrix of bone? A. Magnesium. B. Collagen. C. Sodium. D. Fluoride. B. Collagen. 21. As the activity of osteoblasts increases, the A level of calcium in the blood increases. B. Amount of calcium in bone increases. C. Level of calcium in the blood decreases. D. Both B and C occur. D. Both B and C occur. 22. As the activity of osteoclasts increases, the A level of calcium in the blood increases. B. Amount of calcium in bone increases. C. Level of calcium in the blood decreases. D. Both B and C occur. A level of calcium in the blood increases. 23. Sesamoid bones are classified as blank bones. A long B short, C irregular, D flat. C irregular. 24. Which of the following is not a characteristic of the diaphysis? A. Provides a bulbous shape for attachment of muscle. B. Hollow. C. Composed of compact bone. D. All of the above are characteristics of the diaphysis. A. Provides a bulbous shape for attachment of muscle. 25. Which of the following is not a characteristic of the epiphyses? A. Made of spongy bone. B. Cylindrical in shape. C. Contain red bone marrow. D. All of the above are characteristics of the epiphyses. B. Cylindrical in shape. 26. Which of the following is not dependent on the proper amount of calcium ions in the blood? A. Blood clotting. B. Transmission of nerve impulses. C. Contraction of cardiac muscle. D. All of the above are dependent on the proper amount of calcium ions in the blood. D. All of the above are dependent on the proper amount of calcium ions in the blood. 27. The parathyroid hormone causes all of the following except an increase of the absorption of calcium by the kidney. B. Stimulation of the activity of osteoblasts. C. Stimulation of the activity of osteoclasts. D. Stimulation of vitamin D synthesis. B. Stimulation of the activity of osteoblasts. 28. Which of the following is true of bone but not of cartilage? A. It is classified as a connective tissue. B. It has collagen fibers in its matrix. C. Canals link blood vessels and cells. D. Cells lie in lacunae. C. Canals link blood vessels and cells. 29. Which of the following is not made of hyaline cartilage? A. External air. B. Cartilage rings in the trachea. C. Cartilage connecting the ribs in sternum. D. Cartilage in the tip of the nose. A. External air. 30. Which of the following is not made of elastic cartilage? A. External air. B. Tip of the nose. C. Epiglottis. D. Eustachian tubes. B. Tip of the nose. 31. Which type of bone consists only of compact bone? A. Long. B. Short. C. Irregular. D. All types of bones are composed of both compact and spongy bone. D. All types of bones are composed of both compact and spongy bone. 32. Cancellous bone is another term for a blank bone. A. Irregular. B. Spongy. C. Short. D. Compact. B. Spongy. 33. The humerus is an example of a blank bone. A. Long. B. Short. C. Flat. D. Irregular. A. Long. 34. A vertebral bone is an example of a blank bone. A. Long. B. Short. C. Flat. D. Irregular. D. Irregular. 35. The tarsal bones are examples of blank bones. A. Long. B. Short. C. Flat. D. Irregular. B. Short. 36. The scapula is an example of a blank bone. A. Long. B. Short. C. Flat. D. Irregular. C. Flat. 'C' mostly inorganic salts with a lesser amount of organic material. 38. Hydroxyapatite crystals constitute about how much of the total inorganic matrix? A. 65%. B. 75%. Circa 85%. D. 95%. Circa 85%. 39. What condition results in vitamin D deficiency in children? A. Rickets. B. Osteomalacia. C. Osteoporosis. D. Both A and B. A. Rickets. 40. Lengthwise running central canals are connected to each other by transverse running Haversian canals. B. Volkmann canals. C. Canaliculi. D. Lacunae. B. Volkmann canals. 41. As the amount of calcitonin in the blood increases, the amount of calcium in the blood increases. B. Released from the bone increases. C. In the blood decreases. D. Both A and B are correct. D. Both A and B are correct. 42. A person with a diet rich in calcium would probably have a low level of calcitonin. B. Low level of parathyroid hormone. C. High level of calcitonin. D. Both B and C are correct. D. Both B and C are correct. 43. Which type of bone is found in a tendon? A. Irregular bone. B. Long bone. C. Sesamoid bone. D. Short bone. C. Sesamoid bone. 44. The concentric, cylinder-shaped layers of calcified bone matrix are called the lacunae. B. Canaliculi. C. Central canal. D. Lamellae. D. Lamellae. 45. The small spaces in the matrix that contain the bone cells are called the lacunae. B. Canaliculi. C. Central canal. D. Lamellae. A. Lacunae. 46. Deeply can be found in the diaphysis of a compact bone. B. In the middle of spongy bone. C. In the epiphysis of compact bone. D. Connecting parallel osteons in spongy bone. B. In the middle of spongy bone. 47. In the epiphyseal plate, the proliferating zone is in the black layer. A first, B second, C third, D fourth. B second. 48. In the epiphyseal plate, the zone of hypertrophy is in the black layer. A first, B second, C third, D fourth. C third. 49. Bones act as a reservoir for which of the following minerals? A. Iron. B. Calcium. C. Phosphorus. D. Both A and B. D. Both A and B. 50. The small tubes in the osteon that bring nutrients and oxygen to the osteocytes are called the canaliculi. B. Lacunae. C. Lamellae. D. Deeply. A canaliculi. 1. Which is not a part of the axial skeleton? A. Rib. B. Vertebral column. C. Mandible. D. Clavicle. D. Clavicle. 2. Which is not a part of the appendicular skeleton? A. Coxal bones. B. Parietal bones. C. Radius. D. Clavicle. B. Parietal bones. 3. The axial skeleton consists of blank bones. A. 60 bits 68 circa 74 D. 80. D. 80. 4. The appendicular skeleton consists of blank bones. A. 102 bits 118 circa 126 D. 137. Circa 126. 5. The term sinus, as it relates to bone markings, can be defined as a raised area or projection. B. Cavity within a bone. C. Tuba-like opening or channel. D. Groove or elongated depression. B. Cavity within a bone. 6. Which bone is a part of the axial skeleton? A. Rib. B. Clavicle. C. Radius. D. Coxal bone. A. Rib. 7. Which bone is a part of the appendicular skeleton? A. Scapula. B. Vertebra. C. Parietal. D. Mandible. A. Scapula. 8. Which suture is between the occipital and parietal bones? A. Squamous. B. Lambdoid. C. Sagittal. D. Coronal. B. Lambdoid. 9. Mastoiditis is the inflammation of the sinus within which bone? A. Maxillary. B. Frontal. C. Sphenoid. D. Temporal. D. Temporal. 10. Which skull bone articulates with the first vertebra? A. Temporal. B. Occipital. C. Sphenoid. D. Ethmoid. B. Occipital. 11. The upper parts of the nasal septum and the side walls of the nasal cavity are formed by which bone? A. Nasal. B. Sphenoid. C. Ethmoid. D. Maxilla. C. Ethmoid. C. The ethmoid is an irregular bone that lies anterior to the sphenoid but posterior to the nasal bones. 13. Which of the following bones does not articulate with the maxilla? A. Palatine. B. Mandible. C. Inferior concha. D. Zygomatic. B. Mandible. 14. If the cribriform plate is damaged, there is a chance of infectious materials passing from the ear to the brain. B. Food passing from the mouth into the nose. C. Difficulty chewing. D. Infectious materials passing from the nose to the brain. D. Infectious materials passing from the nose to the brain. 15. A fontanelle can best be described as a bone in the skull. B. An ossified area in the infant skull. C. Articulation between two skull bones. D. Small opening. B. An ossified area in the infant skull. 16. The upper part of the sternum is called the acostal cartilage. B. Xiphoid process. C. Body. D. Manubrium. D. Manubrium. 17. The skeletal framework of the neck consists of blank vertebrae. A. Lumbar. B. Thoracic. C. Sacral. D. Cervical. D. Cervical. 18. The number of thoracic vertebrae is A. 5. B. 7. Circa 10. D. 12. D. 12. 19. All vertebrae except the sacrum and coccyx have a central opening called the A. Spinous process. B. Vertebral foramen. C. Dens. D. Transverse process. B. Vertebral foramen. 20. The thoracic cage includes all of the following bones except the scapula. B. 12 pairs of ribs. C. The vertebral column. D. The sternum. A. The scapula. 21. Which of the following bones is not a part of the face? A. Frontal. B. Zygomatic. C. Lacrimal. D. Maxilla. A. Frontal. 22. Which of the following bones does not contain paranasal sinuses? A. Frontal. B. Maxilla. C. Zygomatic. D. Sphenoid. C. Zygomatic. 23. The occipital bone forms how many joints with other bones? A. 1B. 2C. 3D. 4. D. 4. 24. The largest of the paranasal sinuses is found in which bone? A. Sphenoid. B. Maxilla. C. Ethmoid. D. Frontal. B. Maxilla. 25. Another name for the zygomatic bone is the A. malar, B. sphenoid, C. ethmoid, D. sesamoid. A. malar. 26. Going from superior to inferior, the sequence of the vertebral column is a sacral, coccyx, thoracic, lumbar, and cervical. B. coccyx, sacral, lumbar, thoracic, and cervical. C. cervical, lumbar, thoracic, sacral, and coccyx. D. cervical, thoracic, lumbar, sacral, and coccyx. D. cervical, thoracic, lumbar, sacral, and coccyx. 27. The structure that furnishes the axis for the rotation of the head from side to side is the A. dens, B. spinous process, C. vertebral foramen, D. transverse process. A. dens. 28. The adult skeleton is composed of blank bones. A. 206 bits 126 circa 80 D. 260. A. 206. 29. The bones of the middle ear are considered part of the appendicular skeleton. B. considered part of the axial skeleton. C. not included in either group. D. There are no bones in the middle ear. It is composed only of cartilage. Be considered part of the axial skeleton. 30. The two bones of the face that are not paired are the A. maxilla and mandible, B. maxilla and vomer, C. nasal and maxilla, D. mandible and vomer. D. mandible and vomer. 31. The palatine bone makes up the side of the skull. B. completes the nasal septum. C. makes up part of the hard palate. D. makes up none of the above. C. makes up part of the hard palate. 32. What is the only bone of the body that does not articulate with another bone? A. vomer. B. palatine. C. ethmoid. D. hyoid. D. hyoid. 33. The dens is part of the A. sacrum, B. cervical vertebrae, C. lumbar vertebrae, D. thoracic vertebrae. B. cervical vertebrae. 34. The number of true pairs of ribs in the body is A. 7. B. 12 circa 5 D. 3. A. 7. 35. The sphenoid bone acts as a keystone for the cranium. Which bone acts as a keystone for the face? A. mandible. B. zygomatic. C. maxilla. D. nasal. C. maxilla. 36. Which of the following is not associated with the vertebral column? A. spinous process. B. vertebral foramen. C. dens. D. All of the above are associated with the vertebral column. D. All of the above are associated with the vertebral column. 37. The blunt cartilaginous lower tip of the sternum is called the A body. B. xiphoid process. C. manubrium. D. costal cartilage. B. xiphoid process. 38. The floating ribs articulate with the A vertebrae. B. Sternum. C. Costal cartilage. D. Both A and C are correct. A vertebrae. 39. Which bone marking can be defined as a depression in a bone, and often receives an articulating bone? A. Trochanter. B. Fossa. C. Foramen. D. Ramus. B. Fossa. 40. Which bone marking can be defined as a curved portion of the bone? A. Trochanter. B. Fossa. C. Foramen. D. Ramus. D. Ramus. 41. Which bone marking can be defined as a large bump for the attachment of muscles? A. Trochanter. B. Fossa. C. Foramen. D. Ramus. A. Trochanter. 42. Which bone marking can be defined as a round hole in the bone through which vessels and nerves can pass? A. Trochanter. B. Fossa. C. Foramen. D. Ramus. C. Foramen. 43. Which bone makes up the forehead and the anterior part of the calvaria? A. Occipital. B. Frontal. C. Parietal. D. Temporal. B. Frontal. 44. The two bones that make up the bulging top side of the cranium are the A. Occipital bones, B. Frontal bones, C. Parietal bones, D. Temporal bones. C. Parietal bones. 45. Which bones make up the lower side of the cranium, part of its floor? A. Occipital. B. Frontal. C. Parietal. D. Temporal. D. Temporal. 46. The mandible forms the only movable joint in the skull with the A. Temporal bone, B. Maxilla, C. Frontal bone, D. Zygomatic bone. A. Temporal bone. 47. The almost paper-thin bone that is shaped and sized similar to a fingernail, and lies posterior and lateral to each nasal bone is the blank bone. A. Zygomatic. B. Lacrimal. C. Sphenoid. D. Ethmoid. B. Lacrimal. 48. Which of the following is not found in the eye orbit? A. The eye. B. Muscle of the eye. C. Lacrimal apparatus. D. All of the above are found in the eye orbit. D. All of the above are found in the eye orbit. 49. Which of the following is not a true comparison of a fetal and adult skull? A. The face is a greater part of the skull in the adult. B. The skull is a larger proportion of the body in the adult. C. The skull of the fetus has fontanelles, and the adult skull does not. D. All of the above are true. B. The skull is a larger proportion of the body in the adult. 50. Between the manubrium and the xiphoid process is the A. Body of a true rib, B. Radius in the arm, C. Body of the sternum, D. Fibula of the leg. C. Body of the sternum. 51. Posteriorly convex curvatures of the spine include thoracic and sacral curvatures, B. Cervical and thoracic curvatures, C. Cervical and sacral curvatures, D. Thoracic and lumbar curvatures. A. Thoracic and sacral curvatures. 52. A newborn spine forms a continuous convex curve called a secondary curvature. B. Cervical curvature. C. Primary curvature. D. Lumbar curvature. C. Primary curvature. 53. The fibrous joint between the left and right fetal mandibles that usually fuses within the first year after birth is called the A. Fetal symphysis. B. Maxilla symphysis. C. Mandibular symphysis. D. Pubic symphysis. C. Mandibular symphysis. 1. The layman's name for the clavicle is the A. Collarbone. B. Kneecap. C. Shinbone. D. Elbow. A. Collarbone. 2. The trochlea and capitulum can be described as the markings on the scapula. B. Parts of the proximal end of the ulna. C. Distal portions of the humerus. D. Metacarpal bones. C. Distal portions of the humerus. 3. The human hand has greater dexterity than the forepaw of any animal because of the freely movable joint of the A. Elbow. B. Shoulder. C. Wrist. D. Thumb. D. Thumb. 4. The ulna articulates proximally with the A. Carpal bones. B. Humerus. C. Scapula. D. None of the above is correct. B. Humerus. 5. Metacarpal bones form the framework of the A. Wrist. B. Hand. C. Ankle. D. Foot. B. Hand. 6. The pisiform bone can be found in the A. Wrist. B. Ankle. C. Neck. D. Skull. A. Wrist. 7. The structure above the pelvic inlet, which is bordered by muscle in the front and bone along the sides and back, is called the A. Pelvic brim. B. False pelvis. C. Pelvic girdle. D. True pelvis. B. False pelvis. 8. The anterior of the pelvic girdle is formed by the A. sacrum. B. ilium. C. ischium. D. pubis. D. pubis. 9. During childbirth, a baby passes through an imaginary plane called the A. pelvic outlet. B. symphysis pubis. C. pelvic brim. D. ilium. A. pelvic outlet. 10. The longest and heaviest bone in the body is the A. tibia. B. fibula. C. coxal. D. femur. D. femur. 11. A person with a fractured patella would expect discomfort in the A. elbow. B. knee. C. head. D. ankle. B. knee. 12. Which of the following is not a tarsal bone? A. Cuneiform. B. Navicular. C. Scaphoid. D. Talus. C. Scaphoid. 13. Which of the following is not true? A. The pubic arch in the male is less than a 90-degree angle. B. The pelvic cavity is narrower in the male than in the female. C. The coccyx is less flexible in the male. D. All of the above are true. D. All of the above are true. 14. Going from proximal to distal, the bones of the upper extremity are metacarpals, carpals, ulna, and humerus. Bicarpals, metacarpals, ulna, and humerus. C. Humerus, radius, metacarpals, and carpals. D. Humerus, radius, carpals, and metacarpals. D. Humerus, radius, carpals, and metacarpals. 15. Going from proximal to distal, the bones of the lower extremity are femur, tibia, carpals, and metacarpals. B. Metacarpals, tarsals, femur, and tibia. C. Femur, tibia, tarsals, and metatarsals. D. Tarsals, metatarsals, femur, and tibia. C. Femur, tibia, tarsals, and metatarsals. 16. After the age of 50, the density of bone levels often maintains its composition. B. Decreases slowly because of a shift in the remodeling activity. C. Increases slowly because of a shift in the remodeling activity. D. Decreases slowly because of changes in diet. B. Decreases slowly because of a shift in the remodeling activity. 17. Which of the following may cause skeletal variations? A. Inadequate supply of calcium and vitamin D. Mechanical stress. C. HD. All of the above may cause skeletal variations. D. All of the above may cause skeletal variations. 1. Skeletal muscles constitute approximately blank of our body weight. A. 10%. B. 25%. Circa 50%. D. 75%. Circa 50%. 2. The connective tissue sheet that envelops bundles of muscle fibers is the A. Epimysium. B. Endomysium. C. Periosteum. D. Perimysium. D. Perimysium. 3. The covering of individual muscle fibers is the A. Epimysium. B. Endomysium. C. Periosteum. D. Perimysium. B. Endomysium. 4. Groups of skeletal muscle fibers are bound together by a connective tissue envelope called the A. Endomysium. B. Perimysium. C. Epimysium. D. Aponeurosis. B. Perimysium. 5. An aponeurosis could be described as a flat sheet of connective tissue connecting muscle to other structures. B. Sheet that surrounds tendons. C. Deep fascia that covers muscles. D. Junction between a neuron and a muscle. A flat sheet of connective tissue connecting muscle to other structures. 6. Muscles that contract at the same time as the prime mover are called as synergists. B. Fixators. C. Antagonists. D. Both A and B. D. Both A and B. 7. Which of the following is not a component of a lever system? A. Fixator. B. Bone. C. Joint. D. Pole. A. Fixator. 8. The type of lever arrangement in which the pull is exerted between the fulcrum and resistance or weight to be moved is a blank class lever. A first. B. Second. C. Third. D. Fourth. C. Third. 9. Muscles may be named according to a function. B. Direction of fibers. C. Points of attachment. D. All of the above. D. All of the above. 10. The sternocleidomastoid muscle is an example of a muscle named for its function. B. Number of attachments. C. Size. D. Points of attachment. D. Points of attachment. 11. A muscle that assists with mastication is the A. orbicularis sorice. B. buccinator. C. platysma. D. masseter. D. masseter. 12. The muscle that draws the eyebrows together, producing vertical wrinkles above the nose, is called the A. epicranius. B. corrugator supercilii. C. orbicularis oculi. D. orbicularis sorice. B. corrugator supercilii. 13. Which of the following muscles has fibers on a transverse plane? A. Rectus abdominis. B. External oblique. C. Transverse abdominis. D. Internal intercostals. C. Transverse abdominis. 14. Which of the following muscle function to protect the abdominal viscera? A. External oblique. B. Internal oblique. C. Transversus abdominis. D. All of the above. D. All of the above. 15. Which muscle form most of the pelvic floor? A. Levator ani. B. Coccygeus. C. Ischiocavenosus. D. Both A and B. A. Levator ani. 16. Purposeful movement is determined by the relationship of muscles to joints. B. How muscles are attached to the skeleton. C. The manner in which muscles are grouped. D. All of the above. D. All of the above. 17. Which fibrous connective tissue structures have a lining of synovial membrane? A. Tendon sheaths. B. Aponeurosis. C. Fascicles. D. Both B and C. A. Tendon sheaths. 18. A muscle is attached to the femur and the tibia. When the muscle contracts, the knee bends. That would mean that the A. tibia attachment is the origin. B. femur attachment is the insertion. C. tibia attachment is the insertion. D. Both A and B are correct. C. tibia attachment is the insertion. 19. A muscle is attached to the femur and tibia. Its function or action is to bend the knee. When it contracts, it is acting as the A. antagonist. B. prime mover. C. fixator. D. synergist. B. prime mover. A. The knee is acting as a fulcrum. 21. The origin of a muscle is on the femur, and the insertion is on the tibia. When it contracts, it bends the knee. Its fibers run parallel to the body. Which of the following terms might be part of its name? A. Extensor. B. Abductor. C. Flexor. D. Adductor. C. Flexor. 22. The origin of a muscle is on the femur, and the insertion is on the tibia. When it contracts, it bends the knee. Its fibers run parallel to the body. Which of the following terms might be part of its name? A. Rectus. B. Oblique. C. Femoris. D. Both A and C. D. both A and C. 23. There are more than blank skeletal muscles in the body. A. 1200 bits 900 circa 600 D. 1000. Circa 600. 24. Another name for a skeletal muscle cell is a muscle fiber. B. Fascicle. C. Aponeurosis. D. Fascia. A muscle fiber. 25. The rectus abdominal muscle is an example of a blank muscle. A convergent B. Parallel C. Fusiform D. Pennate. B. Parallel. 26. The brachioradialis muscle is an example of a blank muscle. A convergent B. Parallel C. Fusiform D. Pennate. C. Fusiform. 27. The pectoralis major muscle is an example of a blank muscle. A convergent B. Parallel C. Fusiform D. Pennate. A convergent. 28. The soleus muscle is an example of a blank muscle. A convergent B. Parallel C. Fusiform D. Pennate. D. Pennate. 29. Another name for a sphincter muscle is a blank muscle. A spiral B. Circular C. Fusiform D. Convergent. B. Circular. 30. The most common type of lever in the body is a blank class lever. A first B. Second C. Third D. Fourth C. Third. 31. Moving from superficial to deep, the connective tissue envelopes would be epimysium, perimysium, endomysium. The endomysium, perimysium, epimysium. C. Perimysium, epimysium, endomysium. D. Perimysium, endomysium, epimysium. Epimysium, perimysium, endomysium. 32. The latissimus dorsi muscle is an example of a blank muscle. A bipennate B. Convergent C. Spiral D. Fusiform. C. Spiral. 33. Which of the following is not a group of pennate muscles? A. Bipennate B. Tripennate C. Multipennate D. All of the above are groups of pennate muscles. B. Tripennate. 34. Which of the following statements is incorrect? A. The origin of the muscle is attached to the bone that does not move. B. The insertion of the muscle is attached to the bone that moves. C. When the muscle contracts, the insertion moves toward the origin. D. All of the above are correct. D. All of the above are correct. 35. The prime mover can also be called the A antagonist, B agonist, C fixator, D synergist. B agonist. 'C'. The splenius capitis muscle is sometimes called the prayer muscle because it causes the head to bow. A. When the diaphragm contracts, it decreases the volume of the thoracic cavity and expels air from the lungs. B. Help extend the neck. 39. The psoas minor muscle extends from the bodies of vertebrae T12 and L1 to the A greater trochanter of the femur. B. Gluteal muscles. C. Pubis of the pelvic bone. D. Lesser trochanter of the femur. C. Pubis of the pelvic bone. 1. Which of the following muscles does not move the upper arm? A. Pectoralis major. B. Latissimus dorsi. C. Deltoid. D. Trapezius. D. Trapezius. 2. All of the following muscles are part of the rotator cuff muscles except the A. Deltoid. B. Infraspinatus. C. Supraspinatus. D. Teres minor. A. Deltoid. 3. The teres major and teres minor muscles move the A. Forearm. B. Arm. C. Shoulder. D. Wrist. B. Arm. 4. The muscle that allows the thumb to be drawn across the palm to touch the tip of any finger is the A. Extensor digitorum. B. Opponent pollicis. C. Palmaris longus. D. Flexor carpi radialis. B. Opponent pollicis. 5. The muscle that raises or lowers the shoulders or shrugs them is the A. Deltoid. B. Latissimus dorsi. C. Trapezius. D. Pectoralis minor. C. Trapezius. 6. The muscle that extends and adducts the arm is the A. Deltoid. B. Latissimus dorsi. C. Trapezius. D. Pectoralis minor. B. Latissimus dorsi. 7. The posterior arm muscle that extends the forearm is the A. Biceps brachii. B. Triceps brachii. C. Supinator. D. Brachialis. B. Triceps brachii. 8. The muscle that flexes the semipronated or semi-supinated forearm is the A. Biceps brachii. B. Brachialis. C. Brachioradialis. D. Triceps brachii. C. Brachioradialis. 9. Muscles that move the upper arm originate on the A. Ulna and humerus. B. Clavicle and scapula. C. Humerus. D. Ulna and radius. B. Clavicle and scapula. 10. In pushing a weight from shoulder height to above the head, which of the following muscles is least utilized? A. Triceps brachii. B. Biceps brachii. C. Deltoid. B. Biceps brachii. 11. The muscle assisting in rotating the arm outward is the A. Teres minor. B. Latissimus dorsi. C. Supraspinatus. D. All of the above are correct. A. Teres minor. 12. The action of the brachialis muscle is to blank the forearm. A. Flex. B. Extensi pronate. D. Supinate. A. Flex. 13. The flexor muscles that move the fingers are mostly located on the A. Anterior lateral surface of the forearm. B. Anterior medial surface of the forearm. C. Posterior surface of the forearm. D. Posterior surface of the hand. B. Anterior medial surface of the forearm. 14. Which of the following is not a muscle that moves the thigh? A. Adductor longus. B. Gracilis. C. Iliopsoas. D. Sacrospinalis. D. Sacrospinalis. 15. Which of the following is not a muscle of the quadriceps femoris group? A. Rectus femoris. B. Biceps femoris. C. Vastus medialis. D. Vastus intermedius. B. Biceps femoris. 16. When an athlete injures a muscle of the hamstring group, the injury is on the A. upper arm, B. posterior lower leg, C. posterior thigh, D. anterior thigh. C. posterior thigh. 17. Which of the following is not a muscle that moves the foot? A. Sartorius. B. Peroneus longus. C. Tibialis anterior. D. Soleus. A. Sartorius. 18. Muscles located on the lower leg move the A. thigh, B. hip, C. knee, D. foot. D. foot. 19. Which of the following body systems assists the muscles in maintaining posture? A. Digestive. B. Endocrine. C. Excretory. D. All of the above. D. All of the above. 20. Which of the following is not a posterior muscle that acts on the shoulder girdle? A. Trapezius. B. Pectoralis minor. C. Levator scapulae. D. Rhomboideus. B. Pectoralis minor. 1. Which of the following is not one of the major functions of muscles? A. Movement. B. Protection. C. Heat production. D. Posture. B. Protection. 2. The plasma membrane of a muscle fiber is called the A. sarcolemma, B. myofibril, C. sarcoplasm, D. sarcomere. A sarcolemma. 3. Bundles of fine fibers that extend lengthwise along muscle fibers are called myofibrils, B. myofilaments, C. striae, D. sarcoplasmic reticulum. A. myofibrils. 4. The smallest contractile unit of muscle is a fiber, B. myofibril, C. sarcomere, D. myofilament. C. sarcomere. 5. Blank muscle is also known as striated muscle. A. Smooth. B. Skeletal. C. Involuntary. D. Visceral. B. Skeletal. 6. The ability of muscle cells to respond to nerve stimuli is called irritability, B. contractility, C. extensibility, D. elasticity. A. irritability. 7. In this structure called a triad, the T-tubule is sandwiched between the actin filaments, B. myofibrils, C. sarcolemmas, D. sacs of sarcoplasmic reticulum. D. sacs of sarcoplasmic reticulum. 8. The chief function of the T-tubules is to provide nutrients to the muscle fiber. B. Allow for the fiber to contract. C. Allow for electrical signals to move deeper into the cell. D. Allow for the generation of new muscle fibers. C. Allow for electrical signals to move deeper into the cell. 9. Which of the following proteins found in myofilaments contains the cross bridges? A. Myosin. B. Actin C. Tropomyosin D. Troponin. A. Myosin. 10. The protein molecule that has heads jutting out for cross-bridging is actin. B. Myosin. C. Troponin. D. Tropomyosin. B. Myosin. 11. Thick myofilaments extend the length of the A band. B. Z-line. Circa. I band. D. None of the above are correct. A band. 12. The neurotransmitter secreted at the motor end plates of skeletal muscles is a dopamine. B. Norepinephrine. C. Acetylcholine. D. Any of the above. C. Acetylcholine. 13. The first event to occur in muscle relaxation is that a tropomyosin returns to its original position. B. Myosin cross-bridges are prevented from binding to actin. C. The sarcoplasmic reticulum begins actively pumping calcium back into its sacs. D. Acetylcholine is released. C. The sarcoplasmic reticulum begins actively pumping calcium back into its sacs. 14. The ion necessary for cross-bridging is iron. B. Sodium. C. Potassium. D. Calcium. D. Calcium. 15. The purpose of creatine phosphate in muscle contraction is to carry oxygen. B. Store calcium. C. Replenish energy supply. D. Rotate the cross bridges. C. Replenish energy supply. 16. Aerobic respiration allows the body to avoid the use of oxygen for a short time. B. Results in the formation of an incompletely catabolized molecule. C. Results in the formation of lactate. D. Produces the maximum amount of energy available from each glucose molecule. D. Produces the maximum amount of energy available from each glucose molecule. 17. Skeletal muscles are innervated by somatic motor neurons. B. Autonomic motor neurons. C. Both somatic and autonomic motor neurons. D. Internal stimulation. As somatic motor neurons. 18. A motor unit is most correctly described as blank and a motor neuron. A sarcomere. B. Myofibril. C. Muscle fiber. D. Filament. C. Muscle fiber. 19. White fibers are also called blank fibers. A fast. B. Slow. C. Elongated. D. Intermediate. A fast. 20. Most body movements are blank contractions. A. Isotonic. B. Isometric. C. A combination of isotonic and isometric. D. Single twitch. A. Isotonic. 21. Endurance training is also known as isometrics. B. Hypertrophy. C. Aerobic training. D. Strength training. C. Aerobic training. 22. During which phase of the twitch contraction is there a triggering of the release of calcium ions into the sarcoplasm? A. Latent period. B. Contraction phase. C. Relaxation phase. D. None of the above. A. Latent period. 23. Physiological muscle fatigue may be caused by a relative lack of ATP. B. High levels of lactate. C. Failure of the sodium-potassium pumps. D. All of the above. D. All of the above. 24. All of the following are true characteristics of an isometric contraction except that the muscle does not shorten. B. It can produce work by tightening to resist a force. C. Movement is produced. D. The tension produced by the myosin cross bridges cannot overcome the load placed on the muscle. C. Movement is produced. 25. A contraction in which the tension within the muscle remains the same but the length changes is called a blank contraction. A tonic. B. Isotonic. C. Isometric. D. Tetanic. B. Isotonic. 26. Attempting to pick up an object too heavy to lift would result in which type of muscle contraction? A. Isotonic. B. Flaccid. C. Trip. D. Isometric. D. Isometric. D. Skeletal muscles contract with varying degrees of strength at different times. 28. Painful muscle contractions or involuntary twitches are called the tetanic contractions. B. Cramps. C. Convulsions. D. Fibrillations. B. Cramps. 29. The strength of a muscle contraction is influenced by the A. Amount of load. B. Initial length of muscle fibers. C. Recruitment of motor units. D. All of the above are correct. D. All of the above are correct. 30. Which of the following types of muscle tissue contains cells that have a single nucleus? A. Cardiac. B. Smooth. C. Skeletal. D. Both A and B. B. Smooth. 31. All of the following are characteristics of smooth muscle except that there are no striations. B. There are no T-tubules. C. Thin and thick filaments are aligned in sarcomeres like skeletal muscles. D. The sarcoplasmic reticula are loosely organized. C. Thin and thick filaments are aligned in sarcomeres like skeletal muscles. 32. From smallest to largest, which of the following is the correct order of arrangement? A. Fiber, myofibril, myofilament. B. Myofibril, myofilament, fiber. C. Myofilament, myofibril, fiber. D. Fiber, myofilament, myofibril. C. Myofilament, myofibril, fiber. 33. Sarcolemma is a system of transverse tubules that extend at a right angle to the long axis of the cell. B. Segment of the myofibril between two successive Z-lines. C. Unique name for the plasma membrane of a muscle fiber. D. None of the above are correct. C. Unique name for the plasma membrane of a muscle fiber. 34. Which of the following is not associated with the thin myofilament? A. Troponin. B. Tropomyosin. C. Actin. D. Myosin. D. Myosin. 35. Cross bridges are also called myosin heads. B. Motor end plates. C. Synapses. D. Motor neurons. A myosin heads. 36. TREP is also called a tetanus. B. Electromyography. C. Wave summation. D. Staircase phenomenon. D. Staircase phenomenon. C. The more muscle fibers stimulated by a motor neuron, the more precise the movements of that muscle can be. 38. A decrease in muscle size is termed hyperplasia. B. Atrophy. C. Hypertrophy. D. Trap. B. Atrophy. 39. The characteristic of the muscle cell that directly causes movement is excitability. B. Irritability. C. Contractility. D. Extensibility. E. Elasticity. C. Contractility. 40. A sarcomere is a segment of myofibril between two successive A. Z lines. B. A bands. Circa. I bands. D. H bands. A. Z lines. 41. The striations seen in skeletal muscle cells under the microscope are what part of the sarcomere? A. Z lines. B. A bands. Circa. I bands. D. All of the above. B. A bands. 42. The myofilament that can be described as a globular protein strung together like beads to form two intertwined strands is a troponin. B. Actin. C. Myosin. D. Tropomyosin. B. Actin. 43. The myofilament that can be described as bundle golf clubs with their heads sticking out from the bundle is a troponin. B. Actin. C. Myosin. D. Tropomyosin. C. Myosin. 44. After it is released from the sarcoplasmic reticulum, the calcium combines with which protein? A. Troponin. B. Actin. C. Myosin. D. Tropomyosin. A. Troponin. 45. Glucose can be stored in the muscle as a creatine phosphate. B. ATP. C. Myoglobin. D. Glycogen. D. Glycogen. 46. The substance that attracts oxygen in the myoglobin molecule is a hemoglobin. B. Calcium. C. Iron. D. ATP. C. Iron. 47. The lactate produced by anaerobic respiration is converted back to glucose in the A. lungs. B. Liver. C. Mitochondria. D. Sarcoplasmic reticulum. B. Liver. 48. Which of the following is not a factor in why a warm muscle contracts more forcefully than a cool muscle? A. ATP releases energy faster. B. Calcium diffuses through the sarcoplasm more quickly. C. Calcium tends to accumulate in the sarcoplasm. D. More actin-myosin reactions occur. A. ATP releases energy faster. 49. Which of the following terms describes an isometric contraction? A. Eccentric contraction. B. Static tension. C. Concentric contraction. D. Both A and C. B. Static tension. 50. A satellite cell in a muscle can become active during isotonic contractions. B. During isometric contractions. C. After an injury to a muscle. D. When a muscle becomes fatigued. C. After an injury to a muscle. 51. The myofibrils contain about how many sarcomers? A. 150,000 bits 15,000 circa 1500 d. 150. B. 15,000. 52. The motor end plate makes up part of the A. Z line. B. T tubules. C. Sarcoplasmic reticulum. D. Neuromuscular junction. D. Neuromuscular junction. 53. Which part of the sarcomere stays almost the same size during contraction? A. A band B. I band C. H band D. None of the parts of the sarcomere stay the same size during contraction. A. A band. 54. Muscles usually contract to about blank of their length. A. 30% B. 40% circa 80% D. 90%. Circa 80%. 55. Muscle contractions will continue as long as if the calcium ions are attached to the troponin. B. There is dopamine in the neuromuscular junction. C. There is ADP in the muscle cell. D. T tubules are transmitting impulses. As the calcium ions are attached to the troponin. 56. Which of the following is not an end product of the breakdown of ATP? A. An inorganic phosphate. B. Energy that can be used in muscle contraction. C. ADP. D. All of the above are end products of the breakdown of ATP. D. All of the above are end products of the breakdown of ATP. 57. Which type of muscle does not have T tubules? A. Smooth. B. Cardiac. C. Striated. D. All muscles have T tubules. A. Smooth. 58. Which structure functions to temporarily store calcium ions? A. T tubules. B. Sarcolemma. C. Sarcoplasmic reticulum. D. Myofilaments. C. Sarcoplasmic reticulum. 59. Which type of muscle is responsible for peristalsis? A. Multi-unit smooth. B. Single-unit smooth. C. Cardiac. D. Striated. B. Single-unit smooth. 60. Which of the following is not a name for a muscle cell? A. Muscle fiber. B. Sarcocyte. C. Myocyte. D. All of the above are names for muscle cells. B. Sarcocyte. 61. Which of the following is not a part of the neuromuscular junction? A. T tubules. B. Motor neuron. C. Motor end plate. D. All of the structures are part of the neuromuscular junction. A. T tubules. 62. Which of the following is an incorrect statement regarding heat production? A. The body temperature set point is established by the hypothalamus. B. Shivering will increase body temperature. C. Body temperature functions on a negative feedback mechanism. D. All of the above are correct. D. All of the above are correct. 63. Which of the following statements is incorrect regarding muscle tone? A. Tonic contractions is another name for muscle tone. B. Muscle tone is important in maintaining posture. C. Muscles with less than normal muscle tone are referred to as spastic. D. All of the above statements are correct. C. Muscles with less than normal muscle tone are referred to as spastic. 64. Which of the following statements about cardiac muscle is incorrect? A. Cardiac muscle requires nervous stimulation to contract. B. Cardiac muscle is also called striated involuntary muscle. C. Cardiac muscle contains intercalated discs. D. All of the above statements are correct. A. Cardiac muscle requires nervous stimulation to contract. D. All of the above statements are correct. D. The sodium pump has moved NA+ to the outside of the plasma membrane. 2. The first event to occur when inadequate stimulus is applied to a neuron is that the membrane potential moves immediately to a value of +30 mV. B. The potassium channels open. C. The sodium channels are inactivated. D. Some of the sodium channels at the point of stimulation open. D. Some of the sodium channels at the point of stimulation open. D. The outside of the plasma membrane is negatively charged, and the inside is positively charged. 4. The only ion that can diffuse across the neuron's membrane when the neuron is at rest is a sodium. B. Potassium. C. Proteins. D. Phosphate. B. Potassium. 5. A slight shift away from the resting membrane potentials in a specific region of the plasma membrane is called a blank potential. A membrane B. Resting membrane C. Local D. None of the above is correct. C. Local. 6. During a relative refractory period the action potential cannot be initiated. B. Resting potential exists. C. The cell membrane is impermeable to Na+ and K+. D. The action potential can be initiated with a strong stimulus. D. The action potential can be initiated with a strong stimulus. 7. Within the nervous system, coding for the strength of a stimulus is accomplished through changes in the magnitude of the action potential. B. Changes in the length or duration of the action potential. C. The frequency of nerve impulses. D. An increase in the number of opening sodium channels. C. The frequency of nerve impulses. 8. The fastest nerve fibers in the body can conduct impulses up to approximately blank meters per second. A. 60 bits 85 circa 130 D. 190. Circa 130. 9. A chemical synapse consists of a synaptic knob of a presynaptic neuron. B. A synaptic cleft. C. The plasma membrane of a postsynaptic neuron. D. All of the above. D. All of the above. 10. A synaptic knob would be located on a cell body. B. Axon. C. Dendrite. D. Cell body, axon, or dendrite. B. Axon. 11. When an impulse reaches a synapse, two nerve fibers come in direct contact. B. Impulses will pass in either direction. C. An electrical spark will jump the gap. D. Chemical transmitters are released. D. Chemical transmitters are released. 12. Excitatory neurotransmitters are most likely to increase the speed of impulse conduction. B. Make the cell membrane impermeable. C. Initiate an action potential. D. Make the resting potential more negative. C. Initiate an action potential. 13. When current leaps across an insulating myelin sheath from node to node, the type of impulse conduction is called a repolarization. B. Refraction. C. Saltatory conduction. D. Diffusion. C. Saltatory conduction. 14. For a neurotransmitter to produce an inhibitory postsynaptic potential, which of the following channels must open? A. Sodium and potassium channels. B. Potassium and or chloride channels. C. Sodium and chloride channels. D. Only the sodium channels. B. Potassium and or chloride channels. C. Neurotransmitters released simultaneously from several presynaptic knobs converge on one postsynaptic neuron. 16. Which of the following is not one of the main chemical classes of neurotransmitters? A. Triglycerides. B. Amines. C. Amino acids. D. Neuropeptides. A. Triglycerides. 17. Serotonin is an example of an amino acid neurotransmitter. B. Amine neurotransmitter. C. Acetylcholine derivative. D. Neuropeptide neurotransmitter. B. Amine neurotransmitter. 18. The neurotransmitter that inhibit the conduction of pain impulses is acetylcholine. B. Enkephalins. C. Dopamine. D. Norepinephrine. B. Enkephalins. 19. Neurotransmitters are released in a synapse and bind to a presynaptic terminals. B. The synaptic cleft. C. The base of the axon. D. Receptors on the postsynaptic neuron. D. Receptors on the postsynaptic neuron. B. They are all inhibitory neurotransmitters. 21. Severe depression can be caused by a deficit in certain brain synapses of acetylcholine. B. Amines. C. Amino acids. D. Neuropeptides. D. Neuropeptides. 22. Which of the following is not used by the body as a neurotransmitter? A. Nitric oxide. B. Peroxide. C. Carbon monoxide. D. All of the above are used by the body as neurotransmitters. B. Peroxide. 23. Which of the following antidepressants acts by blocking the action of monoamine oxidase? A. Phenelzine. B. Imipramine. C. Amitriptyline. D. Cocaine. A. Phenelzine. 24. Compared with the outside of the neuron, the inside has a blank charge. A positive B negative C equal D. None of the above are correct. B negative. 25. Acetylcholine is in the same class of neurotransmitters as a serotonin. B histamine. C dopamine. D none of the above. D. None of the above. 26. Dopamine, epinephrine, and norepinephrine are classified as acetylcholine. B. Neuropeptides. C. Catecholamines. D. None of the above. C. Catecholamines. 27. Stimulus-gated channels open in response to a sensory stimuli. B. The influx of potassium. C. Hyperpolarization. D. Both A and B. As sensory stimuli. 28. The fastest nerve fibers in the body can conduct an impulse that is how much faster than the slowest fibers in the body? A. Almost 50 times faster. B. Almost 100 times faster. C. Almost 300 times faster. D. Almost 500 times faster. C. Almost 300 times faster. 29. Which neuron could transmit a nerve impulse the fastest? A. A small diameter neuron without myelin. B. A large diameter neuron without myelin. C. A large diameter neuron with myelin. D. A small diameter neuron with myelin. C. A large diameter neuron with myelin. 30. No impulse can be sent through a neuron during the relative refractory period. B. When the charge of the neuron is -70 C during the absolute refractory period. D. When the stimulus is too strong. C. During the absolute refractory period. 31. A synapse can occur only between an axon and a dendrite. B. A cell body. C. Another axon. D. Any of the above. D. Any of the above. 'D' sodium causes depolarization of the cell membrane, and potassium causes repolarization of the cell membrane. 33. A neurologist is using a voltmeter to measure potential. The membrane potential of a neuron was recorded at +30 mV. This is what type of membrane potential? A. Action. B. Conduction. C. Polarized. D. Resting. A. Action. 34. Which membrane receptor acts to directly change ion permeability when stimulated? A. Metabotropic receptor. B. G protein-coupled receptor. C. Gated channel receptor. D. Ionotropic receptor. C. Gated channel receptor. 35. A type of backward signaling from the postsynaptic neuron back to the presynaptic neuron that may alter synaptic transmission involved in learning and memory is called the postconduction signaling. B. Neuroconduction. C. Retrograde signaling. D. Synaptic signaling. C. Retrograde signaling. 1. The layer of the meninges that serves as the inner periosteum of the cranial bone is the apium mater. B. Arachnoid membrane. C. Dura mater. D. None of the above is correct. C. Dura mater. 2. The innermost layer of the meninges is the apium mater. B. Arachnoid membrane. C. Dura mater. D. None of the above is correct. Apium mater. 3. The main divisions of the central nervous system are the A. Brain, spinal cord, and autonomic nerves. B. Brain, spinal cord, and peripheral nerves. C. Brain and spinal cord. D. Sensory division and motor division. C. Brain and spinal cord. 4. Meningitis refers to inflammation of the A brain. B. Meninges. C. Spinal cord. D. Cerebrospinal fluid. B. Meninges. 5. Cerebrospinal fluid is found in all of the following except the A. Subarachnoid space. B. Central canal. C. Third ventricle. D. Subdural space. D. Subdural space. 6. There are blank ventricles in the brain. A 2-bit 3C4D5. C4. 7. Cerebrospinal fluid is formed by filtration of blood in the A. Central canal. B. Choroid plexuses. C. Subarachnoid space. D. Arachnoid villi. B. Choroid plexuses. 8. Cerebrospinal fluid circulates through the ventricles, into the central canal and blank, and is absorbed back into the blood. A. Subarachnoid space. B. Choroid plexuses. C. Spinal cord. D. Intraventricular foramen. A. Subarachnoid space. 9. If the ventral nerve root of a spinal nerve were destroyed, a person would lose blank related to that pathway. As sensory perception. B. Wilt movement. C. Only reflex activity. D. Both reflex activity and sensation. B. Wilt movement. 10. If the dorsal root ganglia of the spinal nerve were destroyed, a person would lose blank related to that pathway. As sensory perception. B. Wilt movement. C. Only reflex activity. D. Both reflex activity and sensation. As sensory perception. 11. Which of the following is not true of the lateral corticospinal tract fibers? A. Most decussate. B. Most inhibit the lower motor neuron. C. They are referred to as pyramidal pathways. D. They originate in the cerebral cortex. B. Most inhibit the lower motor neuron. 12. Impulses sent over which of the following tracts could result in voluntary movement, especially of the hands, fingers, feet, and toes of the opposite side? A. Medial reticulospinal. B. Lateral reticulospinal. C. Ventral corticospinal. D. Lateral corticospinal. D. Lateral corticospinal. 13. The spinal tract that is located in the side of the cord, originates in the brain, and terminates in the spinal cord is the blank tract. A. Lateral corticospinal. B. Ventral spinothalamic. C. Dorsal corticospinal. D. Lateral spinothalamic. A. Lateral corticospinal. 14. Nerve fibers of the spinothalamic tract are assensory. B. Motor. C. Descending. D. None of the above. Assensory. C. One bundle of nerve fibers projects from each side of the spinal cord. 16. The brain has blank major divisions. A 3-bit 5C68. C6. 17. The brainstem does not include the A. pons. B. Medulla. C. Midbrain. D. Cerebellum. D. Cerebellum. 18. The pyramids are formed in the A. pons. B. Medulla. C. Midbrain. D. Cerebellum. B. Medulla. 19. Several vital centers are located in the A. Basal ganglia. B. Cerebrum. C. Cerebellum. D. Medulla. D. Medulla. 20. The vomiting reflex is mediated by the A. Cerebrum. B. Medulla. C. Thalamus. D. Cerebellum. B. Medulla. 21. The cerebellum acts with the blank to produce skilled movement. A. Hypothalamus. B. Thalamus. C. Pons. D. Cerebrum. D. Cerebrum. 22. The part of the brain that assists in the maintenance of balance is the A. Medulla. B. Pons. C. Cerebellum. D. Hypothalamus. C. Cerebellum. 23. Impulses from the blank play a part in arousing or alerting the cerebrum. A. Pons. B. Thalamus. C. Cerebellum. D. Hypothalamus. B. Thalamus. 24. The part of the brain that can directly influence or inhibit the release of hormones from the pituitary is the A. Hypothalamus. B. Thalamus. C. Medulla. D. Midbrain. A. Hypothalamus. 25. Which of the following is not a function of the hypothalamus? A. Production of hormones. B. Go-between of the psyche and the soma. C. Appetite center. D. Regulation of motor activity. D. Regulation of motor activity. 26. Audition is a function of the blank lobe. A. Occipital. B. Temporal. C. Parietal. D. Frontal. B. Temporal. 27. The cerebellum performs all of the following functions except a coordinates control of muscle action. B. Helps control posture. C. Controls cardiac function. D. Controls skeletal muscles to maintain balance. C. Controls cardiac function. 28. Which part of the brain releases the hormone melatonin? A. Hypothalamus. B. Thalamus. C. Pineal gland. D. Cerebellum. C. Pineal gland. 29. Impulses from which system play a part in arousing or alerting the cerebrum? A. Reticular activating system. B. Limbic system. C. Cerebral cortex. D. Cerebellar cortex. A. Reticular activating system. 30. The areas specializing in language functions are found in the left cerebral hemisphere in about 10% of the population. B. About 50% of the population. C. About 90% of the population. D. All people. C. About 90% of the population. 31. The part of the cerebrum associated with anger, fear, and sorrow is the A. Limbic system. B. Corpus callosum. C. Temporal lobes. D. Caudate nucleus. A. Limbic system. 32. The type of brainwave associated with deep sleep is a beta. B. Theta. C. Zeta. D. Delta. D. Delta. 33. A person who is awake, alert, and attentive would have a predominance of blank brain waves. A. Beta. B. Theta. C. Zeta. D. Delta. A beta. 34. Which of the following is not a brainwave measurement? A. Theta B. Zeta C. Delta D. Beta. B. Zeta. 35. A lesion in the cerebral cortex might result in a motor deficits. B. Sensory deficits. C. Intellectual impairment. D. Any of the above. D. Any of the above. 36. The falx cerebelli separates the A2 hemispheres of the cerebrum. B. Cerebellum from the cerebrum. C. Two hemispheres of the cerebrum. D. Dura mater from the arachnoid. A. Two hemispheres of the cerebrum. 37. The fourth ventricle is located A in the left cerebral hemisphere. B in the right cerebral hemisphere. C below and medial to the lateral ventricles. D where the cerebellum attaches to the brainstem. D where the cerebellum attaches to the brainstem. 38. The layer of the meninges that adheres to the outer surface of the brain is the apium mater. B. Arachnoid membrane. C. Dura mater. D. None of the above is correct. Apium mater. 39. Going from superior to inferior, the structures of the brainstem would be pons, midbrain, medulla oblongata. B. Midbrain, pons, medulla oblongata. C. Midbrain, medulla oblongata, pons. D. Medulla oblongata, pons, midbrain. A. Pons, midbrain, medulla oblongata. 40. The white matter of the cerebellum is called the A. arbor vitae. B. Vermis. C. Peduncle. D. None of the above is correct. A. arbor vitae. 41. The body's biological clock is controlled by the A. pons. B. Thalamus. C. Cerebellum. D. Pineal body. D. Pineal body. 42. The part of the cerebrum integral to articulating words is A. Broca's area. B. The reticular activating system. C. The limbic system. D. The insula. A. Broca's area. 43. The corpus callosum connects the A. cerebral hemispheres. B. Hippocampus. C. Mammillary body. D. Central sulcus. A. Cerebral hemispheres. 44. Axons from the gray horns of the spinal cord terminate in the cerebral cortex. B. Sensory receptors. C. Skeletal muscle. D. None of the above. C. Skeletal muscle. 45. Which of the following is not an inward extension of the dura mater? A. Falx callosum. B. Falx cerebri. C. Falx cerebelli. D. Tentorium cerebelli. A. Falx callosum. 46. Besides protection, the cerebrospinal fluid helps regulate the oxygen content of the body. B. Carbon dioxide content of the body. C. pH of the body. D. Both B and C. D. Both B and C. 'C' anterior fissure is deeper and wider than the posterior fissure. 48. The foramen magnum is the structure that divides the A. medulla oblongata from the pons. B. Pons from the midbrain. C. Medulla oblongata from the spinal cord. D. Brainstem from the cerebellum. C. Medulla oblongata from the spinal cord. 49. The central section of the cerebellum is called the A. arbor vitae. B. Vermis. C. Central sulcus. D. Longitudinal fissure. B. Vermis. 50. The corpus callosum is composed of blank tracts. A commissure row. B. Projection. C. Association. D. Spinothalamic. A commissure row. 51. Which of the following is not a somatic sense? A. Touch. B. Pressure. C. Proprioception. D. All of the above are somatic senses. D. All of the above are somatic senses. 52. Which lobe of the cerebral cortex is not involved in language function? A. Frontal. B. Occipital. C. Temporal. D. All of the above are involved in language function. B. Occipital. 53. Which lobe of the cerebral cortex is not important in memory function? A. Frontal. B. Occipital. C. Temporal. D. Parietal. A. Frontal. 54. The hypothalamus gives rise to a stalk, leading to the posterior lobe of the pituitary gland. The stalk is called the adentic nuclei. B. Infundibulum. C. Internal capsule. D. Pyramidal tract. B. Infundibulum. 55. The nervous system is divided into two major divisions, the A. brain and spinal cord. B. Central nervous system, and the peripheral nervous system. C. Cerebrum and cerebellum. D. Afferent and efferent. B. Central nervous system, and the peripheral nervous system. 56. As you move from the spinal cord up the central nervous system, the A. structural complexity increases. B. Functional complexity increases. C. Structural complexity decreases but the functional complexity increases. D. Both A and B occur. D. Both A and B occur. 57. The epidural space is A. just below the dura mater. B. just below the arachnoid mater. C. found only in the area of the spinal cord. D. between the arachnoid mater and pium mater. C. found only in the area of the spinal cord. 58. The phylum Terminale is part of the A. cerebellum. B. cerebrum. C. spinal cord. D. meninges. D. meninges. 59. If a person received a lumbar puncture that removed 15 milliliters of cerebrospinal fluid from the spinal cord, that amount would be about what percent of the cerebrospinal fluid? A. 20%. B. 10%. Circa 5%. D. 25%. B. 10%. 60. Which of the following structures is not part of the spinal cord? A. Gray commissure. B. Conus medullaris. C. Cauda equina. D. All of the above are part of the spinal cord. C. Cauda equina. 61. The corpora quadrigemina is a landmark of which part of the central nervous system? A. Midbrain. B. Cerebellum. C. hypothalamus. D. Cerebrum. A. Midbrain. 62. The dentate nuclei are an important pair of nuclei in which part of the central nervous system? A. Midbrain. B. Cerebrum. C. Cerebellum. D. Hypothalamus. C. Cerebellum. 63. Which of the following structures is not part of the diencephalon? A. Thalamus. B. Arbor vitae. C. Pineal gland. D. All of the above structures are part of the diencephalon. B. Arbor vitae. 64. What structure is the deepest groove in the cerebrum? A. Central sulcus. B. Fissure of Rolando. C. Fissure of Sylvius. D. Longitudinal fissure. D. Longitudinal fissure. 65. Which groove is between the frontal and parietal lobes? A. Central sulcus. B. Lateral fissure. C. Fissure of Sylvius. D. Longitudinal fissure. A. Central sulcus. 66. What structure drains cerebrospinal fluid into the third ventricle? A. Cerebral aqueduct. B. Interventricular foramen. C. Lateral foramina. D. Cisterna magna. B. Interventricular foramen. 67. What structure drains cerebrospinal fluid into the fourth ventricle? A. Cerebral aqueduct. B. Interventricular foramen. C. Lateral foramina. D. Cisterna magna. A. Cerebral aqueduct. 68. The spinal cord ends at vertebra L1 in a narrowed area called the A cauda equina. B. Filum terminale. C. Conus medullaris. D. Funiculi terminale. C. Conus medullaris. 69. The olive is found in what part of the brain? A. Medulla oblongata. B. Pons. C. Midbrain. D. Cerebellum. A. Medulla oblongata. D. All of the above are correct statements about the midbrain. 71. Which of the following is not a true statement about the cerebellum? A. Its name means little brain. B. It has more neurons than any other part of the nervous system. C. Gray matter makes up the exterior cortex. D. All of the above statements are true. D. All of the above statements are true. 72. What part of the brain can produce a hormone? A. Thalamus. B. Pineal gland. C. Hypothalamus. D. Both B and C. D. Both B and C. 73. What lobe of the cerebrum cannot be seen in an exterior view? A. Temporal. B. Insula. C. Parietal. D. Occipital. B. Insula. 74. Secondary sensory neurons conduct impulses from the spinal cord or brainstem to the A. hypothalamus, B. thalamus, C. cerebellum, D. parietal lobe of the cerebrum. B. thalamus. A. Cerebellum. B. Cerebral cord. A. Without dopamine, the excitatory effects of acetylcholine are not restrained, thus postural muscles are overstimulated. A body movement and posture, and the reticulospinal tract maintains posture during movement. D. Thalamus. 79. When someone close to you dies, you feel a sense of sorrow among other emotions. Your ability to experience emotions is the result of the A. caudate nucleus. B. Limbic system. C. Pineal gland. D. Reticular activating system. B. Limbic system. B. Repeated impulse conduction over a given neuronal circuit produces synaptic changes, which facilitates impulse transmission at the synapse. 81. The set of coordinated commands that control programmed muscle activity mediated by extrapyramidal pathways is called the A. extrapyramidal tract. B. Motor program. C. Motor tract. D. Pyramidal tract. B. Motor program. A. The medulla oblongata contains the vital centers that control heart action, blood vessel diameter, and respiration. 83. The extension of the dura mater that separates the cerebrum from the cerebellum is the A. falx cerebella. B. falx cerebri. C. tentorium cerebella. D. falx centralis. C. tentorium cerebella. 1. All of the following cranial nerves have a functional classification of motor except oculomotor. B. trochlear. C. vestibulocochlear. D. accessory. C. vestibulocochlear. 2. Tic douloureux is a painful neuralgia of the blank nerve. A trigeminal. B. vagus. C. abducens. D. olfactory. A trigeminal. 3. The nerve commonly called the vagus nerve is the blank cranial. A 9th. B. 10th. C. 11th. D. 12th. B. 10th. 4. Which of the following cranial nerves is responsible for movements of the tongue? A. Olfactory. B. Trigeminal. C. Trochlear. D. Hypoglossal. D. Hypoglossal. 5. All of the following cranial nerves are involved in proprioception except the A. vagus. B. hypoglossal. C. accessory. D. abducens. A. vagus. 6. Which of the following is not a plexus of the spinal nerves? A. cervical. B. brachial. C. lumbar. D. thoracic. D. thoracic. 7. The cervical plexus A is found deep in the neck. B is formed by the ventral rami of the first 4 cervical nerves and part of C5. C includes the phrenic nerve. D. All of the above are correct. D. All of the above are correct. 8. Which plexus contains nerves that innervate the lower part of the shoulder and the entire arm? A. brachial. B. cervical. C. lumbar. D. sacral. A. brachial. 9. The sensory cranial nerves include only the A optic, vestibulocochlear, and vagus. B olfactory, optic, and facial. C olfactory, optic, and vestibulocochlear. D optic, facial, and vestibulocochlear. C olfactory, optic, and vestibulocochlear. 10. The cranial nerve that arises from the spinal cord is the A abducens. B accessory. C glossopharyngeal. D vagus. B accessory. 11. Nerve impulses over the blank nerve cause increased peristalsis and decreased heart rate. A olfactory, B trigeminal, C vagus, D hypoglossal. C vagus. 12. The spinal nerves are connected to the spinal cord and consist of blank pairs. A. 12 bits 21 circa 31D. 41. Circa 31. 13. Spinal nerves are blank fibers. A only sensory, B only motor, C completely autonomic, D motor and sensory. D motor and sensory. 14. A mixed nerve is one that goes both to the skin surface and to the viscera. B has its pathway mixed with other nerves. C carries both sensory and motor fibers. D carries large and small motor fibers. C carries both sensory and motor fibers. 15. Damage to the blank nerve could make the diaphragm unable to function. A phrenic, B axillary, C radial, D medial cutaneous. A phrenic. 16. The phrenic nerve is found in the blank plexus. A cervical, B brachial, C lumbar, D sacral. A cervical. 17. Which is the neurotransmitter in a somatic motor pathway? A. Acetylcholine, B. Amine, C. Amino acids, D. Neuropeptides. A. Acetylcholine. 18. Nerves that innervate the floor of the pelvic cavity and some of the surrounding areas are found in the blank plexus. A sacral, B cervical, C coccygeal, D lumbar. C coccygeal. 'B' impulses that mediate it enter and leave the same segment of the cord. 20. Which of the following is not true of the knee-jerk reflex? A. It is a flexor reflex. B. It is an ipsilateral reflex. C. It is a spinal cord reflex. D. It does not have to involve the brain. A. It is a flexor reflex. 21. Normal infants will show the Babinski reflex up to the age of blank years. A. 1 bit 2 circa 2D. 3. A. 1. 22. Which of the following is a correct statement? A. There are 7 cervical nerve pairs. B. There are 11 thoracic nerve pairs. C. There are 5 lumbar nerve pairs. D. All of the above are correct statements. C. There are 5 lumbar nerve pairs. 23. The lumbar plexus gives rise to the blank nerve. A median, B phrenic, C femoral, D. None of the above is correct. C femoral. 24. The peripheral nervous system includes only spinal nerves. B. Only spinal nerves and their branches. C. Only cranial nerves, spinal nerves, and their branches. D. Cranial nerves, the spinal cord, spinal nerves, and their branches. C. Only cranial nerves, spinal nerves, and their branches. 25. The peripheral nervous system includes blank nerves. A. Autonomic, B. Sensory, C. Somatic, D. All of the above. D. All of the above. 26. Which part of the vertebral column has one more pair of nerves coming from it than it has vertebrae? A. Cervical, B. Thoracic, C. Lumbar, D. Both B and C. A. Cervical. 27. Which is not true of the ventral nerve root? A. It is also called the anterior root. B. It contains the spinal ganglion. C. It includes motor neurons. D. All of the above are true. B. It contains the spinal ganglion. 28. Which is not true of the dorsal nerve root? A. It is also called the posterior root. B. It includes the spinal ganglion. C. It includes sensory fibers. D. All of the above are true. D. All of the above are true. 29. Which is the only plexus that contains fibers from the thoracic region of the spinal cord? A. Cervical, B. Brachial, C. Lumbar, D. Sacral. B. Brachial. 30. Which of the following is not associated with the oculomotor nerve? A. Movement of external eye muscles, B. Closing and opening of the eye, C. Movement of intrinsic eye muscles, D. Proprioception of eye muscles. B. Closing and opening of the eye. 31. Which of the following is not a branch of the trigeminal nerve? A. Zygomatic nerve, B. Ophthalmic nerve, C. Maxillary nerve, D. Mandibular nerve. A. Zygomatic nerve. 32. Which of the following cranial nerves is not associated with eye movement? A. Oculomotor, B. Trochlear, C. Trigeminal, D. Abducens. C. Trigeminal. 33. Afferent nerves or fibers are found only in the blank nervous system. A. Sensory, B. Autonomic, C. Central, D. Both A and B are correct. D. Both A and B are correct. 34. Efferent nerves or fibers are found only in the blank system. A. Central, B. Autonomic, C. Somatic, D. Both B and C are correct. D. Both B and C are correct. 35. The cauda equina A is part of the cervical plexus. B refers to the nerves below the ending of the spinal cord. C is part of the brachial plexus. D is a term used to describe the groups of cranial nerves leaving the skull. B refers to the nerves below the ending of the spinal cord. 36. Which segment of the vertebral column generates more spinal nerve pairs than any other segment? A. Cervical, B. Thoracic, C. Lumbar, D. Sacral. B. thoracic. 37. The spinal ganglion can be found on the blank of the spinal nerve. A dorsal nerve root. B. Dorsal ramus. C. Ventral nerve root. D. Ventral ramus. A dorsal nerve root. 38. Small branches from the cervical plexus join which two cranial nerves? A. Vagus and hypoglossal. B. Vagus and accessory. C. Hypoglossal and accessory. D. Glossopharyngeal and hypoglossal. C. Hypoglossal and accessory. 39. By age 2 years in a normal infant, the stimulus that once caused the Babinski reflex now causes the knee jerk reflex. B. The ankle jerk reflex. C. The plantar reflex. D. No reaction at all. C. The plantar reflex. 40. A gymnast is experiencing problems with balance and equilibrium. Which of the following cranial nerves may be causing this condition? A. Accessory. B. Glossopharyngeal. C. Hypoglossal. D. Vestibulocochlear. D. Vestibulocochlear. A. Hypoglossal nerve damage, and a decrease in proprioception of the tongue. C. Voluntary. Outside. C. Stretch of the tendon, the quadriceps femoris, and thereby stimulation of the muscle spindles. C. A somatic reflex is caused by contraction of skeletal muscles, whereas an autonomic reflex consists of contraction of smooth or cardiac muscle or secretions of glands. A. The diaphragm would stop contracting. B. A cutaneous nerve is affected by the virus causing shingles, which remains dormant in the dorsal root ganglion for years. B. Herpes zoster. B. The corticospinal fibers have not yet become fully myelinated and the Babinski reflex is activated. 49. Judy has sustained an injury that has damaged the vestibulocochlear nerve. This injury will have an effect on her ability to hear. B. Move her jaw. C. Open and close her eyes. D. Maneuver her tongue. A. Hear. 50. A patient complains of numbness in the skin of the buttocks and the posterior surface of the thigh and leg. The spinal nerve or peripheral branch most likely involved with this condition is the blank plexus. A. Brachial. B. Cervical. C. Coccygeal. D. Thoracic. C. Coccygeal. 1. Which generalization concerning the autonomic nervous system is not true? A. All of its axons are afferent fibers. B. It operates without conscious control. C. It regulates visceral activities. D. All of its neurons are motor. A. All of its axons are afferent fibers. 2. Which of the following would not be a major effector of the autonomic nervous system? A. Skeletal muscles. B. Blood vessels. C. Sweat glands. D. Iris of the eye. A. Skeletal muscles. 3. Somatic motor and autonomic pathways share all of the following characteristics except a direction of information flow. B. Location of peripheral fibers. C. Number of neurons between central nervous system and effector. D. Acetylcholine. C. Number of neurons between central nervous system and effector. 4. The autonomic nervous system functions chiefly in the A. Coordination of muscular activity. B. Innervation of smooth muscle in the viscera. C. Reception of sensory impulses. D. Arousal of alerting mechanism. B. Innervation of smooth muscle in the viscera. D. Do all of the above. D. Preganglionic fibers synapse with several postsynaptic fibers. 7. Parasympathetic neuron cell bodies are located in the white columns of the sacral segments of the spinal cord. B. The lateral gray columns of thoracic segments of the spinal cord. C. Nuclei of the brainstem and the lateral gray columns of the sacral cord. D. Collateral ganglia. C. Nuclei of the brainstem and the lateral gray columns of the sacral cord. 8. Which of the following is not an example of sympathetic stimulation? A. Constriction of the bronchioles. B. Decreased secretion of the pancreas. C. Constriction of the urinary sphincters. D. Dilation of skeletal muscle blood vessels. A. Constriction of the bronchioles. 9. All of the following are examples of parasympathetic stimulation except a contraction of the urinary bladder. B. Relaxation of the sphincters of the digestive tract. C. Increased salivation. D. Increased heart rate. D. Increased heart rate. 10. Fight or flight physiological changes include all of the following except increased conversion of glycogen into glucose. B. Constriction of respiratory airways. C. Increased sweating. D. Dilation of blood vessels in skeletal muscles. B. Constriction of respiratory airways. B. They have long fibers from CNS to ganglion. 12. Norepinephrine is liberated out of the dendrite ending. B. Parasympathetic preganglionic nerve endings. C. Most sympathetic postganglionic nerve endings. D. Sympathetic preganglionic nerve endings. C. Most sympathetic postganglionic nerve endings. 13. Beta receptors A are cholinergic. B. Bind acetylcholine. C. Bind norepinephrine. D. Bind the toxin muscarine. C. Bind norepinephrine. 14. Propranolol is an example of a beta blocker. B. Drug used to treat irregular heartbeats. C. Drug used to treat hypertension. D. All of the above are correct. D. All of the above are correct. B. The sympathetic nervous system. 16. Which of the following might occur from the stimulation of parasympathetic fibers? A. Goosebumps. B. Dilation of blood vessels to skeletal muscle. C. Increased blood sugar. D. Increased peristalsis in the digestive tract. D. Increased peristalsis in the digestive tract. 17. Parasympathetic stimulation has no effect on any of the following areas except the sweat glands. B. Skin blood vessels. C. The liver. D. The urinary bladder. D. The urinary bladder. C. The major function of the parasympathetic division is to serve as an emergency system. 19. Alpha receptors bind with the acetylcholine. B. Norepinephrine. C. The toxin muscarine. D. None of the above. B. Norepinephrine. 20. Which is not true about sympathetic postganglionic neurons? A. They are usually longer than preganglionic neurons. B. They produce acetylcholine. C. They produce norepinephrine. D. They have acetylcholine receptors on their dendrites. Preganglionic neurons. B. 21. Which is not true about parasympathetic postganglionic neurons? A. They are usually shorter than the preganglionic neurons. B. They produce acetylcholine as a neurotransmitter. C. They produce norepinephrine as a neurotransmitter. D. They have acetylcholine receptors on their dendrites. C. They produce norepinephrine as a neurotransmitter. 22. Acetylcholine can stimulate blank receptors. A. Alpha, B, beta, C, nicotinic, D, both alpha and beta. C, nicotinic. 23. Norepinephrine can stimulate blank receptors. A. Alpha, B, beta, C, nicotinic, D, both alpha and beta. D, both alpha and beta. A. A dually innervated effector receives input from both sympathetic and parasympathetic pathways. A singly innervated autonomic effector receives input from only the sympathetic division. C. If sympathetic impulses tend to stimulate an effector, parasympathetic impulses tend to inhibit it. 26. Both sympathetic and parasympathetic divisions are tonically active, which means they are hydrolyzed by the enzyme acetylcholine. B. Continually conduct impulses to autonomic effectors. C. Continually conduct impulses to the brain. D. Have opposing effects. B. Continually conduct impulses to autonomic effectors. C. Hormones secreted by the adrenal medulla may not reach the various sympathetic effectors, thus delaying the effects of sympathetic stimulation. 1. The special senses A are widely distributed throughout the body. B. Enable us to detect pain. C. Are dense in the fingertips. D. Are grouped in the tongue, nose, eyes, and ears. D. Are grouped in the tongue, nose, eyes, and ears. 2. Pain that is perceived as being superficial but actually is caused by an underlying organ is called blank pain. A phantom B referred, C chronic, D acute. B referred. 3. Visoreceptors are located in which of the following? A. Skin B. Tendon C. Internal organs D. Skeletal muscles. C. Internal organs. 4. General sense organs enable us to detect sensations, including a touch. B. Temperature. C. Pain. D. All of the above. D. All of the above. 5. Intense stimuli of any type that results in tissue damage will activate mechanoreceptors. B. Thermoreceptors. C. nociceptors. D. Photoreceptors. C. Nociceptors. 6. Chemoreceptors are most likely to be activated by cold temperatures. B. Noxious odors. C. Pain. D. A change of receptor position. B. Noxious odors. 7. The receptors responsible for sensing crude and persistent touch are the A. Meissner corpuscles. B. Cross-end bulbs. C. Ruffini corpuscles. D. Free nerve endings. C. Ruffini corpuscles. 8. Which of the following is true of proprioceptors? A. Function in relation to movement and position. B. Are superficial receptors. C. Are internal receptors. D. Are receptors for general senses such as touch, pressure, heat, and cold. A. Function in relation to movement and position. 9. Free nerve endings respond to all of the following stimuli except a tickling. B. Itching. C. Strength of muscle contractions. D. Pain. C. Strength of muscle contractions. 10. Lamellar corpuscles are least numerous in the A. Palms of the hands. B. Joints of the body. C. Skin of the back. D. Soles of the feet. C. Skin of the back. 11. Which of the following receptors are found in most body tissues? A. Free nerve endings. B. Meissner corpuscles. C. Cross-end bulbs. D. Ruffini corpuscles. A. Free nerve endings. 12. Proprioceptors can be found in A. The urinary bladder. B. Major blood vessels of the body. C. Skeletal muscles. D. Both A and C. C. Skeletal muscles. 13. The word deform describes the stimulus detected by chemoreceptors. B. Mechanoreceptors. C. Photoreceptors. D. Thermoreceptors. B. Mechanoreceptors. 14. Which of the following is true about pain receptors? A. Alpha fibers respond to chronic pain. B. Alpha fibers are associated with dull, aching pain. C. Alpha fibers are associated with sharp, localized pain. D. Beta fibers are associated with sharp, localized pain. C. Alpha fibers are associated with sharp, localized pain. 15. Which of the following is an anatomical variant of a Meissner corpuscle? A. Cross-end bulb. B. Pacinian corpuscle. C. Ruffini corpuscle. D. Both A and C. D. Both A and C. 16. The two general classes of sense organs are auditory and visual. B. Peripheral and central. C. General and special. D. Chemoreceptors and mechanoreceptors. C. General and special. 17. Sensory impulses ending in what part of the central nervous system may affect the so-called vital sign reflexes? A. Thalamus. B. Cerebellum. C. Brainstem. D. Cerebral cortex. C. Brainstem. 18. Sensory impulses ending in what part of the CNS trigger imprecise or crude sensation awareness? A. Thalamus. B. cerebellum C, brainstem D, cerebral cortex. A. Thalamus. 19. Sensory impulses ending in what part of the CNS give specific awareness of a specific type of sensation, its exact location, and its level of intensity? A. Thalamus. B. Cerebellum. C. Brainstem. D. Cerebral cortex. D. Cerebral cortex. 20. The two-point discrimination test can be used to measure a visual acuity. B. The ability to determine the location of a sound. C. The sensitivity of the skin in various parts of the body. D. The ability to measure the relative temperature of two different objects. C. The sensitivity of the skin in various parts of the body. 21. What types of receptors are important in stimulating the thirst center? A. Mechanoreceptors. B. Osmoreceptors. C. Chemoreceptors. D. Thermoreceptors. B. Osmoreceptors. 22. If you slammed your finger in a car door, it would stimulate blank pain fibers. A. Chronic. B. Acute. C. Visceral. D. Both chronic and visceral. B. Acute. 23. Which term is another name for a variant of a Meissner corpuscle called the bulboid corpuscle? A. Cross-end bulb. B. Ruffini corpuscle. C. Lamellar corpuscle. D. Root hair plexus. A. Cross-end bulb. 24. Which term is another name for a variant of a Meissner corpuscle called the bulbous corpuscle? A. Cross-end bulb. B. Ruffini corpuscle. C. Lamellar corpuscle. D. Root hair plexus. B. Ruffini corpuscle. 25. Which large mechanoreceptor, when sectioned, shows thick laminated connective tissue capsules? A. Cross-end bulb. B. Ruffini corpuscle. C. Lamellar corpuscle. D. Root hair plexus. C. Lamellar corpuscle. 'B'. The magnitude of a receptor response decreases over time to a continuous stimulus. 27. Which of the following statements is not true of extoreceptors? A. They send both tonic and phasic impulses to the CNS. B. They are also called cutaneous receptors. C. They are located on or near the surface of the body. D. All of the above statements are true of extoreceptors. A. They send both tonic and phasic impulses to the CNS. 28. Tactile meniscus is another name for the A. Meissner corpuscle. B. Lamellar corpuscle. C. Tendon receptor. D. Miracle disc. D. Miracle disc. 29. Which of the following is not true of a receptor potential? A. It follows the all or none law. B. It is a graded response. C. It occurs when an adequate stimulus acts on a receptor. D. It can stimulate an action potential in the axon of a sensory neuron. A. It follows the all or none law. 30. Which of the following is considered a somatic sense? A. Smell. B. Taste. C. Equilibrium. D. None of the above. D. None of the above. 31. The two general classes of sense organs are auditory and visual. B. Peripheral and central. C. General and special. D. Chemoreceptors and mechanoreceptors. C. General and special. 32. When referring to the sensory neurons, the term end organ refers to the blank lobe of the brain. A. Occipital. B. Temporal. C. Parietal. D. None of the above is correct. D. None of the above is correct. 33. Which of the following is not true of a receptor potential? A. It follows the all or none law. B. It is a graded response. C. It occurs when an adequate stimulus acts on a receptor. D. It can stimulate an action potential in the axon of a sensory neuron. A. It follows the all or none law. 34. Somatic sensory receptors are found in the A. Skin. B. Muscles. C. Eyes and ears. D. All of the above. D. All of the above. 1. The olfactory tract carries impulses associated with a taste. B. Equilibrium. C. Smell. D. Pain. C. Smell. 2. There are blank openings into the middle layer. A 2-bit 3C4D5. C4. 3. Both olfactory receptors and taste buds are thermoreceptors. B. Chemoreceptors. C. Nociceptors. D. Mechanoreceptors. B. Chemoreceptors. 4. The number of pure, or primary, tastes is about A. 5B. 15 circa 30D. 100. A. 5. 5. All of the following are primary taste sensations except A. Sweet. B. Sour. C. Spicy. D. Bitter. C. Spicy. 6. The auditory ossicles include the A. Malleus. B. Incus. C. Stapes. D. All of the above are correct. D. All of the above are correct. 7. Which of the following is not a part of the bony labyrinth? A. Semicircular canal. B. Malleus. C. Vestibule. D. Cochlea. B. Malleus. 8. The spiral organ is located in the A. Vestibule. B. Semicircular canal. C. Scala vestibuli. D. Cochlear duct. D. Cochlear duct. 9. Movement of hair cells in the spiral organ against the blank membrane can stimulate nerve impulse condition. A. Tectorial. B. basilar. C. vestibular. D. cochlear. A. Tectorial. 10. Which of the following structures is not a component of the external ear? A. Auricle. B. Cerumen secreting gland. C. Eustachian tube. D. External auditory meatus. C. Eustachian tube. 11. The tympanic membrana leads from the auricle into the temporal bone. B. Surrounds the cochlea and the semicircular canals. C. Is continuous with the external auditory meatus. D. Is also known as the inner ear. C is continuous with the external auditory meatus. 12. Impulses are transmitted from the inner ear to the brain by way of the blank nerve. A vestibulobicochlear, C tectorial, D oculomotor. Bicochlear. 13. The sense organs responsible for static equilibrium are located in the A utricle, B saccule, C semicircular canals, D. Both A and B are correct. D. Both A and B are correct. 14. The semicircular canals are in blank planes of the body. A 2-bit 3C4D5. B3. 15. The major function of the utricle and saccule in the vestibule is transmitting sound waves through bones. B. Changing sound waves into nerve impulses. C. Detecting the position of the head. D. Conducting sound waves through endolymph. C. Detecting the position of the head. 16. Blood vessels are found in which of the following parts of the eye? A. Cornea, B. Lens, C. Choroid, D. Aqueous humor. C. Choroid. 17. The white of the eye is referred to as the A sclera, B choroid, C retina, D cornea. A sclera. 18. The part of the eye containing nervous tissue is the A sclera, B choroid, C iris, D retina. D retina. 19. Which of the following is a true statement? A. Cones are more numerous than rods. B. Cones are most densely concentrated in the fovea centralis. C. Rods are most densely concentrated in the macula lutea. D. Cones increase in density toward the periphery of the retina. B. Cones are most densely concentrated in the fovea centralis. 20. To produce a clear image, the aqueous humor is involved in the process of a refraction. B. Constriction. C. Accommodation. D. Convergence. A refraction. 21. The function of the lacrimal apparatus is to secrete aqueous humor. B. Secrete vitreous humor. C. Drain aqueous humor. D. Secrete tears. D. Secrete tears. 22. Presbyopia is a condition resulting from excessive aqueous humor. B. Opacity of the lens. C. Loss of lens elasticity. D. Irregular curvature of the cornea. C. Loss of lens elasticity. 23. Which of the following must happen for near vision to occur? A. Increased tension of the suspensory ligament. B. Relaxation of the ciliary muscle. C. Increased curvature of the lens. D. Contraction of the superior rectus muscle. C. Increased curvature of the lens. 24. Strabismus is a problem related to a convergence. B. Accommodation. C. Refraction. D. Constriction. A convergence. 25. Which of the following is a primary photopigment? A. Green. B. Orange. C. White. D. Purple. A. Green. 26. There are how many types of cones in the retina? A. 1b, 2c, 3d, 4, c, 3. 27. The inability to focus the lens properly as we age is called myopia. B. Hyperopia. C. Presbyopia. D. Astigmatism. C. Presbyopia. 28. Which is not true of nearsightedness? A. Light rays converge in front of the retina. B. The eyeball may be too long. C. Convex glasses are used for correction. D. If uncorrected, the image is blurred. C. Convex glasses are used for correction. 29. Irregular curvature of the cornea can produce a myopia. B. Glaucoma. C. Hyperopia. D. Astigmatism. D. Astigmatism. 30. Which of the following is not a structure of the middle ear? A. Incus. B. Stapes. C. Auditory tube. D. Vestibule. D. Vestibule. 31. Which of the following structures is concerned with hearing? A. Utricle. B. Saccule. C. Semicircular canals. D. Cochlear duct. D. Cochlear duct. 32. The passageway leading to the tympanic membrane is the A. External auditory meatus. A. External auditory meatus. B. Auditory tube. C. Eustachian tube. D. Oviwindow. A. External auditory meatus. 33. The eyelids and anterior surface of the eye are lined by the A. cornea. B. iris. C. lens. D. conjunctiva. D. conjunctiva. 34. Tongue papillae are classified by which of the following? Ascent. B. Structure. C. Location. D. Function. B. Structure. 35. The word cochlea means a shell. B. Snail. C. Crest. D. Ocean. B. Snail. 36. Taste buds can be found in the lining of the mouth. B. On the soft palate. C. On the tongue. D. In all of the above locations. D. In all of the above locations. 37. Which of the following tongue papillae do not have taste buds? A. Fungiform. B. Filiform. C. Foliate. D. All of the above contain taste buds. B. Filiform. 38. Which structure is not inside the vestibule of the inner ear? A. Cochlear duct. B. Utricle. C. Saccule. D. All of the above are in the vestibule. A. Cochlear duct. 39. Which of the following is not an accessory structure of the eye? A. Eyebrows. B. Eyelashes. C. The palpebrae. D. All of the above are accessory structures. D. All of the above are accessory structures. 40. Clearness or sharpness of visual perception is known as a control. B. Peripheral sense. C. Visual acuity. D. Visual balance. C. Visual acuity. 41. How many subdivisions does the anterior cavity of the eyeball have? A1, B2, C4, D. None. B2. 42. The sequence of auditory ossicles in the middle ear starting at the tympanic membrane and ending at the oval window is a malleus, incus, and stapes. B. Malleus, stapes, and incus. C. Stapes, malleus, and incus. D. Stapes, incus, and malleus. A malleus, incus, and stapes. 43. Which tongue papillae are huge dome-shaped bumps that form a transverse row near the back of the tongue? A. Fungiform papillae. B. Circumvallate papillae. C. Foliate papillae. D. Filiform papillae. B. Circumvallate papillae. 44. Which tongue papillae do not contain taste buds but allow us to experience food texture and feel? A. Fungiform papillae. B. Circumvallate papillae. C. Foliate papillae. D. Filiform papillae. D. Filiform papillae. 45. Which tongue papillae are large, mushroom-shaped bumps found in the anterior two-thirds of the tongue surface? A. Fungiform papillae. B. Circumvallate papillae. C. Foliate papillae. D. Filiform papillae. A. Fungiform papillae. 46. Of all the papillae on the tongue, which one contains the most taste buds? A. Fungiform papillae. B. Circumvallate papillae. C. Foliate papillae. D. All papillae contain about the same number of taste buds. B. Circumvallate papillae. 47. Cones that are sensitive to light in the blue wavelength wave are referred to as blank cones. A. BB. LC. ST. M. C. S. 48. When you are looking at a large green field, which cones would be sending the green wavelength to the brain? A. GB. LC. ST. M. D. M. 49. The photopigment melanopsin is found in A. rods only. B. cones only. C. ganglion cells. D. both rods and cones. C. ganglion cells. 50. Which of the following statements is not true of the olfactory receptors? A. They are chemoreceptors. B. They are located in an area that is easily stimulated. C. The sense of smell in humans is less keen than in many other animals. D. All of the above statements are true. B. They are located in an area that is easily stimulated. D. All of the above statements are true. 52. Which of the following statements is not true of the eye? A. The anterior cavity is filled with vitreous fluid. B. The anterior cavity is divided into anterior and posterior chambers. C. The posterior cavity is larger than the anterior cavity. D. All of the above statements are true. A. The anterior cavity is filled with vitreous fluid. 1. The most widespread and abundant tissue in the body is A. epithelial. B. connective. C. muscle. D. Nervous. B. Connective. 2. Blood is a member of which basic tissue type? A. Epithelial. B. Connective. C. Muscle. D. Nervous. B. Connective. 3. How can epithelial tissue be described? A. Forms glands. B. Contains mostly extracellular matrix. C. Forms membranes. D. Both A and C. D. Both A and C. 4. Which of the following epithelial functions is a primary activity of glandular epithelium? A. Protection. B. Secretion. C. Sensation. D. Excretion. B. Secretion. 5. What structure is formed by the union of the basal and reticular lamina? A. Nucleus. B. Basement membrane. C. Lysosome. D. Endoplasmic reticulum. B. Basement membrane. 6. Which is not a function of epithelial tissue? A. Absorption. B. Secretion. C. Assimilation. D. Protection. C. Assimilation. 7. Which of the following is not a function of adipose tissue? A. Insulates to conserve body heat. B. Defends the body from microbes and injurious substances. C. Supports and protects the kidneys. D. Stores excess food. B. Defends the body from microbes and injurious substances. 8. Which is not a function of connective tissue? A. Transport. B. Support. C. Defense. D. Communication. D. Communication. 9. Collagenous fibers can be found extensively in blank tissue. A. Epithelial. B. Connective. C. Muscle. D. Nervous. B. Connective. 10. The type of tissue referred to as loose ordinary connective tissue is areolar. B. Adipose. C. Reticular. D. Cartilage. Areolar. 11. The basic organizational or structural unit of compact bone is called the A. Canaliculi. B. Lamellae. C. lacunae. D. Aversian system. D. Aversian system. 12. Cartilage is a form of blank tissue. A. Epithelial. B. Connective. C. Muscle. D. Osseous. B. Connective. 13. The mature cells of bone are called fibroblasts. B. Osteoclasts. C. Osteocytes. D. Osteoblasts. C. Osteocytes. 14. The most prevalent type of cartilage is a hyaline. B. Fibrous. C. Elastic. D. synovial. A hyaline. 15. Which of the following is not considered a formed element in the blood? A. Erythrocyte. B. Thrombocyte. C. Astrocyte. D. Leukocyte. C. Astrocyte. 16. The type of tissue that contains cells called neurons is called muscle. B. Epithelial. C. Connective. D. Nervous. D. Nervous. 17. Which of the following is another name for skeletal muscle? A. Striated voluntary. B. Non-striated involuntary. C. Striated involuntary. D. Pseudostriated involuntary. A. Striated voluntary. 18. Basement membrane is composed of molecules made by blank tissue. A muscle B connective C epithelial D. Both B and C are correct. D. Both B and C are correct. 19. Areolar tissue usually contains which types of cells in the greatest number? A. Macrophages B. Fibroblasts C. Mast cells D. Phagocytes. B. Fibroblasts. 20. Cells found only in cartilage include achondrocytes and fibroblasts. B. Chondrocytes and macrophages. C. Chondrocytes and mast cells. D. Only chondrocytes. D. Only chondrocytes. 21. Which of the following is not a characteristic of skeletal muscles? A. Having one nucleus per cell B. Being attached to bone C. Having striations D. Having voluntary or willed muscles. B. Having intercalated discs. 22. Which of the following is not a characteristic of smooth muscles? A. Having one nucleus per cell B. Having intercalated disc C. Composing the walls of the viscera D. Usually not being under voluntary control. B. Having intercalated discs. 23. Which of the following is not a proteoglycan found in the matrix of connective tissue? A. Glucosamine B. Collagen C. Hyaluronic acid D. All of the above are proteoglycans. B. Collagen. 24. Cancellous tissue is an example of which type of connective tissue? A. Cartilage B. Bone C. Dense connective D. Loose connective. B. Bone. 25. An axon is an important part of which kind of tissue? A. Nervous B. Smooth muscle C. Cardiac muscle D. Glandular epithelium. A. Nervous. 26. Connective tissue forms from embryonic tissue called mesenchyme. B. Blastocyst. C. Endoderm. D. Ectoderm. A mesenchyme. 27. Which of the following is not a class of cartilage tissue? A. Hyaline B. Fibrocartilage C. Cancellous D. Elastic. C. Cancellous. 28. Which type of connective tissue helps newborns maintain body temperature by producing heat? A. Dense fibrous tissue B. Beige fat C. Brown fat D. White fat. C. Brown fat. 29. Small spaces in the bone where osteoblast